please turn off and turn down your cell phones to vibrate. Silence, thank you. Roll call, please.
Betts.
Here.
Carter.
Here.
Cowart. Esri.
Here.
Holderfield. Here. James.
Here.
Jay.
Here.
Kibler.
Here.
Kurtz.
Here.
Langenheim.
Here.
Maxwell.
Here.
McGinty.
Here.
Michaels. Here. Mitchell.
Here.
Mosher.
Here.
O'Connor.
Here.
Petrie. Here. Quisenberry.
Here.
Richards.
Here.
Rosales.
Here.
Schrader.
Here.
Alex.
Here.
Ammons. Here. Anderson. Here. Benzel.
Here.
Bergson.
Here.
Weigel.
Here, we have a quorum. Tonight's prayer. If you've been paying attention to my prayers, and some of you maybe have not, you notice I try to pull prayers just about out of every religion in every country in the world. We've never had a Jewish prayer. So this is the first. My wife sort of hinted it'd be nice to have one. I should tell you that Jewish prayers are short, generally speaking. I think because they want to get to the food, which is after the prayer. And the prayer I read is the Sheheki Anu, which is generally prayer at the beginning of something like the first prayer of Hanukkah. It's not necessarily appropriate for tonight because we're at the end of the session, but on the other hand, I won't be at the beginning session, so I can't say it there, so I'll say it now. So here it is. Baruch atah Adonai, Elohim melech haelom. Sheki anu, v'keki manu, v'hi anu lasam hesa. An English version of this. Blessed are you, Lord, our God, who rules the universe. Who has granted us life, sustained us, and enabled us to reach this occasion. Amen. Pledge of allegiance. Where's the flag? All right, no flag, let's stand up. Pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The clerk, read the notice of the meeting, please.
Notice is hereby given that a regular meeting of the County Board, Champaign County, Illinois, will convene on November 27, 2012, 7 p.m. in the ILEA's Training Center, 1701 East Main Street, Urbana, Illinois, in said county for the purpose of allowing and ordering payments of claims against the county, receiving and acting upon reports of committees, and such other matters as may be brought before said meeting, which said meeting shall continue in session from day to day until the completion of said business.
Move approval.
Second by Mr. Kibler. All in favor?
Aye.
All opposed? Motion carries. Seek approval of the agenda and the addenda.
So moved.
Mr. James, second by Mr. Carter. Well, let's make a motion to suspend the rules to add several items that cannot be done with the committee.
So moved.
Moved by Ms. Holderfield, second by Mr. Alex. Discussion. All in favor?
Aye.
All opposed? Motion carries. I pulled off item D10. I pulled off completely, that's the finance. It turns out that this concerns the fee that we collect for electrical aggregation. Turns out the county cannot do that. We'll refuse to talk to you about more of that later on in the meeting. And finally, I'd like to add our tag, the presentation, which we'll put in right after the nursing home program report for that item. Is there any problems with that? They told me that the presentation is not very long.
2 hours.
And also, the closed session, and we move the closed session so it's in front of other business. We'll have finance, closed session, new business, then we'll get to the other business part. Right? Actually, is there any objection to that stuff?
Question.
Liz? Yes.
During caucus, you mentioned you were pulling 2 items off consent.
Well, I'm going to put an item off the agenda right now.
Oh, okay, sorry.
Okay. All right, further discussion? All in favor?
Aye.
All opposed? Motion carries. Date and time for the next regular meetings. On Monday, next Monday, December 3rd at 7 p.m. In the Shields meeting room will be the county board organizational meeting. Tuesday, December 11th, will be the only committee of the whole meeting for the month of December at 6 p.m. in the Shields meeting room. And the regular county board meeting will be on December 20th, Thursday at 7 p.m. in the Shields room. Okay, consent agenda. I'm going to pull off item C13, which is policy, because the item that I pulled off the agenda completely has an effect on that. There will be a new copy of that on your desk. And the devil explains the changes in that. Any other items you'd like to pull off the consent agenda?
Move consent.
Second.
Moved by Mr. McGinty, second by Ms. Ammons. Roll call.
Betts.
Yep.
Carter.
Yes.
Cowart.
Yes.
Esri.
Yes.
Holderfield.
Yes.
James.
Yes.
Jay.
Yes.
Kibler.
Yes.
Kurtz.
Yes.
Langenheim.
Aye.
Maxwell.
Yes.
McGinty.
Yes.
Michaels.
Yes.
Mitchell.
Yes.
Mosher.
Yes.
O'Connor.
Yes.
Petrie.
Yes.
Quisenberry.
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Ammons. Yes. Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Weigel.
Yes, the motion carries. Next up is public participation. Those of you who wish to speak, please fill out one of these forms in the back on the counter over there. First speaker is Jennifer Putnam.
Good evening, all you friends. I came here tonight to see history being made, or watch a page of it being turned. I want to wish the new 22-member board success. The folks who are having their last meeting tonight, 9 of you, every single one of the 9 of you, we've had our times to kind of rock and roll. We have been times when I said, yay, or you may have hurt my feelings, or driven me crazy, or supported me, sustained me. For the 9 of you who are having your last meeting tonight, I want to thank you so much for making the Champaign County Board business unfold as it has. I know the mistake of singling people out for trying to say all the wonderful things they've done, because you'll regret the item that you miss. But I have to say a very special goodbye, good luck to my seatmate, former seatmate, running mate, Tom, who taught me the word aspiration. It's what we try to do, and how politics is the compromise and the science of what is possible. Thank you very much for that, Tom, and for all the good and fun times that we've had. Jan, thank you so much for being my sister in public health, in all of the good government activities that we've participated in together. You mean so much to me. The times we'd be there out in the parking lot somewhere and couldn't get the issue resolved, and one of those moments, or it's just meant everything to me to have you on the county board. And thank you so much for, after the public health referendum passed, deciding that it was time for you to join and be on the county board. I left something at your desk to specially thank you for your support for the Child Dental Access Program that has now turned into Smile Healthy, which is about to become Smile Healthy, along with Francis Nelson, 2 divisions of Promise Healthcare. But this is a little postage stamp. We give a framed postage stamp that celebrates dental care to every student who interns or volunteers with our program at the end of the semester. I know you all need more things to keep on your mantelpieces, but I hope that you will accept this as a reminder of the wonderful things that a program that began here on the Champaign County Board has been able to do to improve the dental health, oral health of men and women all across Champaign County. And I want to thank all of you for your continuing support to the program. Chair Weigel, you got a little thing like this too. You've been a wonderful friend of our public health, this aspect of our public health program. And there's another member of your family who's been a real supporter of our program. So Ms. Feldman, I have one of these for you too. Susan was an interpreter and supporter of our program to way back when. And if you think 2 of these little things in one family is too much, give one to a dentist who's been part of the dental referral program, or give it to your dentist, and she or he will know that you believe in oral health and for all people, regardless of their ability to pay for it. The other token to Chair Pius Weibel is something that we presented to Representative Jacobson and Senator Frerichs when we passed the bill that's going to, it is hoped, the proof will be in the tasting of the pudding, to have more representative juries. It's a framed copy of this little postage stamp. The slogan reads, "Jury duty, serve with pride." And you'll see 12 faces, in profile, all the different hues that a human could possibly be, and then some. It's our goal to have representative juries. And thank you very much for appointing me to the Citizens Advisory Committee on Jury Service. And Tom, as an attorney, of course, I wanted you to have one too. Thank you so very much. Best wishes. And Pius, I'm going to have this picture of you and Alea and Imani and Susan from the National Park with your hair down to here, kind of really enjoying life like Chair Weibel likes to enjoy his life. And I wish you a lot more wonderful time with your family, and that you enjoy geology again too. Thank you so very much.
John Farney?
Well, I just wanted to take a moment to thank all the retiring board members for their service to Champaign County, and as an employee of Champaign County, I've appreciated the opportunity to talk with each and every one of you over the last several years, and we've appreciated the way that you've listened. Even though we may not have agreed on everything, you were open to ideas, and we've gotten through some troubling times here in county government over the last 4 or 5 years, and we were able to do it together, and I think that's a very positive thing. So I want to thank each and every one of you for that. I want to thank Chairman Weibel for his leadership during that time as well. It's been noticed, and it's helped make Champaign County a great place to work. And I also want to, like Jenny said, we shouldn't single anybody out, but Mr. Mosier and Mr. O'Connor were my representatives growing up in Philo, and I will forever be indebted to them for letting me be part of politics with them. So, thank you.
Good evening. My name is David Thies. I'm an attorney. 807 South McKinley is where I live in Champaign, and it seems like old home week, and as a retired member of the county board, I feel like I should launch into thanking all of you for your service as well. I'm actually here on a piece of business. My colleague Phil Van Ness and I are attorneys for Sangamon Valley Water. We're here to again urge your support for the requested change in zoning for a parcel of property in Mahomet that is planned for use as an expansion of the Sangamon Valley facility. As a matter of zoning, this doesn't seem controversial to us at all. This is an essential service. Our customers need the water that is being provided, the services that are being provided. There is expansion outside of Mahomet, and again, as a matter of continuing the use of property adjoining the property to be rezoned, it is very consistent with the zoning laws of the county and the state. We understand that it is controversial because of the desire that we work together with Mahomet to address some of their concerns. And I just want to not go through everything we said last time, but just remind you of one point, and that is that although annexation to Mahomet is something that, as a unit of local government, we don't feel should be imposed upon us, just about everything else that Mahomet needs or has asked us for can be worked out, and it can be worked out as an intergovernmental agreement. The question was asked last time whether a pre-annexation agreement was possible, and the answer was that annexation is a problem, philosophically. But every other aspect of an intergovernmental agreement is is very possible. So thank you for your support. We continue to urge that you would support us tonight as well. Thank you.
Aaron Evans?
Aaron Emmons, 1108 North Busey. Here, of course, to share with my wife and her last county board meeting, and we're going to miss especially certain folks who say things like, no, yes. We talk about you guys all the time. Mr. Carter, I don't understand this. How y'all keep doing it? Mr. Weigel, I don't understand half the stuff you say to tell the truth. Just trying to lighten the mood. I know for me, I've been involved, I guess, with the community and government now for maybe 10 to 12 years, and many of you have been involved much longer than that. And so I have a lot to learn, and though it may not seem like it when we're rallying our troops and coming here and yelling and screaming, it may not seem like we're listening, but we have conversations about what we think are the legitimate points that you make. We go back and talk about them. But knowing how hard it is to get people to actually sacrifice, to have a job, to have children, to have all the other different things going on in your life, and still come here, read these packets, try to be as aware and alert and abreast of what's going on while everything else is going on in your life. I know that it takes a sacrifice. So I appreciate all of you. I'm getting over a cold, but I appreciate all your sacrifice and your time. And you probably won't be the last you'll see of me, but I wanted to thank especially all of you who are leaving out. And, congratulations to the new chair, and congratulations to all the new people who are going to be serving. Hopefully you'll continue to serve in the best interest of the community. And so thank you very much.
Claudia Lenoff?
Good evening. My name is Claudia Lenhoff, and I'm the Executive Director of the Champaign County Healthcare Consumers. And I just wanted to say, y'all look like a lot more in here, the way you're organized this way, than over in the county, in your regular county board meeting room. I, first of all, wanted to thank all of you for your service. Aaron put it beautifully. You do diligent service for the people of Champaign County, and it is appreciated. I especially wanted to to just come and say thank you to the outgoing board members. It feels like an end of an era. It makes me a little bit melancholy. Mr. Mosier, Mr. O'Connor, I was coming in front of the county board started coming about 17 years ago. We didn't always see eye to eye on issues, but I do appreciate your service and everybody else who's been on the board. I think we've accomplished a lot in terms of public health, dental health for the county, and as Jenny said, the dental program has evolved and grown into an amazing nonprofit and that I'm very proud of. I'm proud of the Board of Health members also for that. I wanted to especially say a word of thanks to Jan Anderson for her service, especially in advancing the health of county residents. I had the honor of working with Jan before she joined the county board in the public health campaign, and I learned a lot from you, Jan, and I really appreciate you. And you're kind of soft-spoken, but you are a mighty and steady advocate for health for the people of Champaign County. And I know you're retiring from here, but that'll give you more time to volunteer, so I appreciate that. And again, thanks to all of you. We appreciate your service, and congratulations to the new chair and the new folks coming on. Thank you.
Is there any more public participation? Mr. John Gill.
I'm John Dimmitt, 2711 Plantation Point, Urbana. I just wanted to rise and thank people for their service tonight. As someone who was an employee of the county and witnessed the transformation from the Board of Supervisors with 50-some people down to 27 and now down to 22, with each transition there was a large number of folks that left and a lot of talent that left and a lot of people that I grew to respect and learned a tremendous amount from. and that learning never ceases. And even though I'm retired from the county, there are many of you here tonight that are leaving the board from which I've learned a great deal on both sides of the aisle, and it was a real pleasure working with you. I do understand the time that's involved. A lot of times I produce a lot of pages that I ask you to read, and I could tell that you read it because of the way that you asked me questions afterwards, and so I know the time that it took. But in particular, I think Steve, and Tom, the three of you that have been here, I think the longest that I've worked with, and Steve and Mosier in particular, being on the Regional Planning Commission for all those years. I'm going to miss the nicknames that Steve has for everyone, and I don't know what mine is, so I'm hoping now that you're retired, I probably will. Once I find out, I may not like it, but it's been a real pleasure working with all of you, and I want to thank you for the time that you put in to make Champaign County a place that it's worthwhile spending 45, 50 years of your life working to make the place better. And I certainly appreciated my time here, and it would not have been possible without all of you that I regard as personal friends. Thank you.
Any other public participation? We now close that, go on to communications. Ms. Holyfield.
I have a communication for immediate release that was sent out from the Convention and Visitors Bureau. I wanted to share with all of you because County Board did participate in some of the excitement that has been brought to Champaign County. The increase in Lincoln-related tourism anticipated in Champaign County. Champaign, Illinois, with an upcoming biopic Lincoln from director Steven Spielberg going into wide release last Friday, Champaign County Convention and Visitors Bureau anticipates a new generation of Lincoln enthusiasts will explore the numerous exhibits dedicated to Lincoln in Champaign County. While Abraham Lincoln never lived in the area, he often traveled to Champaign County to work civil and criminal cases in Champaign County Courthouse. For over 20 years, Lincoln practiced law on the 8th Judicial Court and traveled to various county seats from Decatur to Danville, which included stops to Urbana. Lincoln unsuccessfully defended the first person accused of murder in the county and defended the interests of the Illinois Central Railroad. Due to significant amount of time Lincoln spent in the county, many exhibits and attractions have been established honoring the legend, ranging from the interactive exhibit Abraham Lincoln, large presence in a small town at the Champaign County Courthouse, to Champaign County's Lincolns at the Museum of the Grand Prairie. The Lincoln Trail in Illinois has also been a large draw to many areas within the state, including Champaign County, says Jane DeLuz, President and CEO of Champaign County Convention and Visitors Bureau. With the epic film being released, we expect a new generation of history buffs and Lincoln enthusiasts to take to the Lincoln Trail to see the impact this legend had on our great state and our community. The CVB developed a comprehensive listing of all attractions and exhibits in the area dedicated to Abraham Lincoln that may be of interest to those seeking to learn more about his history in Champaign County. The listing may be found at www.visitchampaigncounty.org/Lincoln. The Champaign County Welcome Center houses brochures developed by the Museum of the Grand Prairie that map out the Lincoln Story Trail that takes you through Mahomet, Tolono, Champaign, Urbana, Homer, and St. Joseph, as well as a comprehensive brochure from the Lincoln Heritage Coalition, Looking for Lincoln, that provides detailed information for the landscape and sites where Lincoln traveled and lived in central Illinois. For more information on Lincoln and Champaign County, contact the Champaign County Convention and Visitors Bureau.
I have two of them. One, first of all, the closed session we're going to have. The county board is going to leave the room to go to another room to have a closed session, so anyone who's not on the county board can stay here and eat cake. You need to tell away that. Also, I have a announcement from the Illinois Commerce Commission. I just got this yesterday, and because the Ameren Transmission Company is going to construct, operate, and maintain new high-voltage electric certified and related facilities in Champaign County and many other counties, they're going to have a pre-hearing conference on December 3rd, 2012 at 10:30 at the ICC Commission Office in Springfield, which is the Leland Building, 527 East Capitol Avenue. Want more information, the docket number is 12-0598, you can find that on the website. And you can post this on our okay, any other communications? The minutes, since we just received copies of the minutes, I'm going to give you a chance to look at them. We'll approve them later in the meeting. And we try to multitask and keep this up. Next is the nursing home quarterly report. Scott?
Good evening, everyone.
If you want to stand in the middle, you can. You don't have to stay right there.
Okay.
Best for you.
Can you do my before I get started, I wanted to say thank you to the county board and especially to the outgoing members for all the work that has been done over the last few years with the county nursing home. So I've just been around for a few months, and we've been working very closely with my partner Mike Scavato, and thanks all of you for all the work. And I think significant progress that we've made with the county nursing home. And unfortunately, a lot more work to be done over the next few years with the nursing home. All right, that being said, I have good news for this report, for this quarterly report, and everything we talk about is as of September of 2012. The main highlights you see here is we have hit an all-time census high in September, and we broke that record in October. In September, our average daily census was 210.5. Medicare was 14.6. In October, our average census is 211.9, and Medicare is up a little bit at 15.1. So Medicare, I'm never going to be happy with the Medicare, but it is a lot better than what it was earlier this year when we were in the single digits. So we have been making significant progress. And because of the increased census, in August, we were at break even, and actually a slight profit of $408. In September, we showed a profit of $35,000 for the month. As I think we said time and time again, census drives the bottom line. And you can see, starting with December of this fiscal year, we started off 82%. We went through the doldrums in the spring at 78.5%. And we're up to 86.6% as of September, and obviously October will be a little bit higher than that. Our average daily census, this breaks it down by payer. Top line is everyone in the building at 210.5 in September, and you can see that we're at a low of just under 191 in March. Medicaid is the next line from the top. We started off at 105, and we have been creeping up. And I have to caveat what you're seeing in September, because it shows that we have 139.1 residents. And then you see private pay dropping to 56.8 in September. That is because we've had a conversion of 630 private pay days to Medicaid. Those are individuals who are coming into the building, not necessarily coming into the building, but maybe they were private pay, used up their assets, converting to Medicaid, or became as Medicare, and are now converting to be a long-term resident as Medicaid, and they've never been in a nursing home before. So they are going through the application process for Medicaid. That process can take 6 months on average here in Champaign County. And so if I was admitted 6 months ago, and I finally get approved, 6 months worth of patient days in revenue have to be converted from private pay to Medicaid. And so in September, we had 630 days that we converted from private pay to Medicaid. And that's the reason why you see that increase in Medicaid and drop in private pay.
Scott, if I could ask a question.
Yes, sir.
Does that mean you're taking those backdated days at the end of the month in that month?
Yes.
Okay.
Yeah, so we're not going back and changing the census from the previous month, but we're changing all those days in the month of September. And then in October, we're going to see the same thing again, because I think we had 650 days that we converted for the month of October. So it's going to look even wacky.
Scott, another question.
Just a quick question here. Is this something that you plan to do on an annual basis where you do it maybe semi-annually, or do you think you'll start prorating it by months so you don't have that big drop and we have a little more consistency in the figures?
What we've been talking about doing internally at APA, because this is an issue that we have with all our homes.
Sure.
Now, DeKalb is even more. For DeKalb County, it can be up to a year before some of these people get approval for Medicaid. We may consider breaking it out instead of as private pay as a Medicaid pending category, both on the revenue and on the date standpoint, so you don't see these fluctuations. But the gist of it is that we're not getting paid for those revenues while we're waiting. So it does totally distort the monthly statistics and the revenues, but there's no easy way around it. But we think we're going to create a new category among our income statement and their statistics. Okay, so this is a historical trend of our average daily census starting in January of 08. I'm sorry, yeah, January of 08 to September of 2012. And you can see, and I can't even remember now when we showed up, but I know we were down to about 146 in 2008. And you can see there's been a steady trend up to where we are in our current year, or current month. And so you can see we have hit an all-time high in September. Now this gives you a better picture of what the pyramid is, because this is a year-to-date basis. Oops, I hit the wrong button. So Medicare, we're at 7.7%, and we're behind on what our budget target was, and we're a little bit behind from 2011. Medicaid on a year-to-date basis is 57%, which is higher than what we've seen last year, and private pay is down 35% compared to 37%. Yes?
Scott, on the payer mix, the rates are different, correct, for Medicare, Medicaid, and private pay. So
Yes.
being that is going to be backdated, the date that that person applies for, if they go from private pay to, or Medicare to a Medicaid dollar, then that 650 days that you're waiting for payment, that's all at the Medicaid rate, correct?
Yes.
Okay, and that drops because it's, could you remind us what the difference is between each of those three
Okay,
rates?
so if they were private pay converted to Medicaid, roughly we're going from $180 per day to about $150 a day. So we're taking out $30 a day.
And do you also see conversion from like a Medicare to a Medicaid?
Well, if it's converting from Medicare to Medicaid, is actually going to be Medicare private pay, and then when we finally convert to Medicaid, from private pay to Medicaid.
Thank you.
All right. This, I'm sorry. Okay, no, I did it. All right. So, why has our census increased? This question was asked at the Board of Directors meeting. And there's a number of reasons, and I've broken it out to internal and external reasons. Internal meaning what we're doing within the facility to try to improve what we're doing to take care of our residents. The first is strong nursing leadership. Again, I'm losing my train of thought of when we hired a new director of nursing, but that has made a significant difference in the clinical care and the skill level of our nursing staff since we made that change. We've also improved our employee mix. What does that mean? It means that we have changed our hiring practices to try to recruit better CNAs and better LPNs and RNs as much as possible. And we've also have a policy of uniform adherence to our policies and procedures and disciplinary policies and procedures. So what does that mean? It means that if our staff messes up, we don't write them off. We go through the disciplinary process, identify what was done incorrectly, implement corrective action, and give them the opportunity to improve their behavior. But if they don't, we'll go through the process, and fortunately, if we have to discharge someone, we will. But we're going to dot all the I's and cross the T's and do it uniformly and treat everyone fairly. And we've also had really worked on improving our working relationship and communication with the union. And I think today we have a much better relationship with ASME. Reduction in agency staff. I think we've talked about that over and over. We've made great strides, but we still have more work to do to try to eliminate agency staff within the building. And we are focusing on reducing hospital readmissions, something I'll talk about a little bit later. But the results are that we are seeing improved resident care. External reasons. What this is what are we doing with the other providers in the area, especially with the hospitals, physicians, and I put Health Alliance in because we see a fair amount of Medicare managed care residents or patients through Health Alliance. And over the past 2 years, we have been doing a significant amount of work with both hospitals and their respective physicians, communicating with what we're doing internally to try to improve resident care, but also working with those providers to improve what I call the transition of care process. What happens when someone from the hospital comes to the nursing home? What happens when someone from the nursing home goes to the hospital? That transition, in the past, there's a lot of things that fall between the cracks in terms of what is communicated and what's not communicated. And we're working very hard with the hospitals to improve that. And I have one example that we've just started working on over the last couple of months. We're trying to develop the ability to electronically transmit a hospital discharge file from the hospital to the nursing home. And hopefully, within the next 12 months, we'll actually get that implemented. We're working with one of our software vendors that we work with the nursing home. But if we can get that information electronically, we get it timely, and we can distribute it to our staff and to the doctors and the nurse practitioners who work at the facility. Eventually, we want to take our information from the nursing home, and we have to send someone to the hospital, send our information to the hospital, so the ER docs and the many physicians have information of what we've done in care of that resident at the facility. This is kind of a recap of, I think I talked about this last time, about the recent changes that we've had in our revenues and expenses. So back in October of 2011, we had a 12% cut in our Medicare rates. In October of this year, we had a 1.8% increase in our Medicare rate, which was a surprise. Back in July of this year, we had a 1.5% Medicaid cut, and a big item on the expenses was the addition of a new bed tax by the state that was equivalent to about $32,000 a month in additional expenses. And so for this year, that equates to roughly about $137,000 through November. So what does our bottom line look like so far this year through September? Net income is a negative $187,000. Compared to last year, 2011 at the same time, we've improved by $151,000. Still not in the black, but we have made improvements from last year. And again, we're at this point because of the low census that we had in the spring. If you add back depreciation through September,
You notice that the 2011 year-to-date total revenue is not summed up correctly. It's actually around 12.48 million, which then brings us a little even further difference. Or actually makes our net income loss be about the same as last year.
okay, I'm sorry. Thanks for pointing that out. All right, if we add back depreciation, we're showing a net cash increase of $419,000 year-to-date. Patient care reviews, Medicare, Medicaid, and private pay. Yes, Gary?
Now, our cash, was that in, does it need to look better because we actually got 2 payments in one calendar month recently?
In September, we did get an extra Medicaid payment.
So we may not get one in October.
That is a good question. Which I don't know the So Medicare, well, all patient care revenues, we've seen basically not much of a change. We've lost $24,000 in all the patient care revenue total, comparing 2012 to 2011. Obviously, we've taken a huge hit with Medicare because of the low census so far in 2012. We're talking a loss of $762,000 between 2011 and 2012. That's strictly census driven. Medicaid, we're up by $500,000. Private pay, we're up by $240,000. So this Medicaid is up because of the overall census. And that has been able to mitigate the loss that we're seeing so far with Medicare. Expenses. Labor expenses. Salaries have gone up by $162,000 or 3.1%. But if I do salaries divided by resident days, because our census has increased this year, we've had less than a 1%, or I'm sorry, less than a 1% decrease in our actual salaries per day. So that is a good trend. So our average cost per day has dropped by 52 cents per resident day. Benefits, which I always say we really don't have much control over, has increased by 9%. Benefits per day has gone up by 5.4% or $1.59 a day. Non-labor expenses have been pretty much held in check. It's increased by $30,000 from 2011, or less than a 1% increase. And I'm just pointing out some of the bigger expense items that have changed. The bed tax is a big one. Agency, we've reduced our agency expenses year to date by 27% from 2011. Therapy expenses, which again are directly related to our Medicare census, so I would expect that we would see our therapy expenses down, and that's down by 17%. This is a historical chart going back to December of 2007 of our monthly profit or loss. So you can see that there's huge fluctuations that we've seen. But the general trend is back in 2008 or the end of 2007, we had months where we're losing over $200,000. And we have made significant improvements in getting ourselves moving in the right direction over the past 6 years.
May I ask a clarification?
Yes, sir.
So this is really comparing apples and oranges from what I understand here, because it's 2011 year-to-date, so that's the full 12 months. And the figures you're giving us for 2012 are just for 9 months, correct?
If I'm doing year-to-date, it's doing December through September of 2011 compared to December through September of 2012.
Thank you.
All right, historical trend of our monthly revenues. Again, you can see that we've shown this gradual increase over the years. This is an aberration that you see in 2009 because of the state wanting us to book the IGT money a certain way, where we had to book all of the revenues for Medicaid here, and that we had to expense out a significant portion of what got returned back to the state. So if you want to say that's play money, that's the way I look at it. It shouldn't look more like it's going this way. And ignoring these numbers here. Expense.
Can I just ask a quick clarification? I'm pretty sure this is the case, but I assume that the way that this is being presented, from a revenue perspective, none of the anticipation warrants are illustrated as revenue, or are they? Tax anticipation, revenue anticipation, either one.
I believe they're in there, because I know that was something that Mike had been working on, getting those into the books on an accrual basis. And I believe they're in there, but I'm not 100%
spread out.
sure. Yes.
All right.
Okay, so now we look at our monthly revenues divided by the resident days in that month. This is a sobering graph, because you can see, while in the previous chart, the revenues show a slight increase on a per day basis, and this is no surprise, our average reimbursement per day has been dropping steadily. So now we're above $200 when we started off at roughly, in some cases, almost $250 a month. And again, I should caveat, these are high because of the IGT revenue and the way we're booking them in those months. But compared to our expenses per day, the reason why we're able to show an increasing profit trend over the years is because we have been able to significantly reduce our operating expenses. Where we were close to $250 a day on average, and in some months we would hit $270, we are now down to about $200 a day. And I think in September we were below that. I can't remember the numbers off the top of my head. But this is a huge change that we've been able to implement with operations.
Can you give us a better understanding of how this is being accomplished?
Squeezing out as many extra dollars out of operations as possible without impacting overall patient care. So what does that mean? We didn't come in to slash FTEs because that would directly impact patient care. But some of the things I talked about before, try to improve the staff that we hire, try to reduce turnover. And our turnover rate is still high, but I believe it's less than what it was probably way back in 2008. We've changed our contracts for pharmacy. That's a big item for Medicare. Therapy contracts were renegotiated. That significantly reduced our costs. Supplies, food, all those things we're always looking at on a monthly basis. And while they're not huge dollar amounts, $1,000 here, $1,000 there, every month starts adding up over time. So it's a lot of bigger things, but also a lot of little things at the same time. And contract nursing is a huge item on the expense side. So you can see back in 2009, we were spending $150,000 to over $190,000 in 1 month. And while we've seen some blips over the last couple of months, we have made significant strides in reducing our reliance on agency staff over the last few years.
Scott, real quick, the trim lines that you're using there, are those just linear trim lines or like arcs or anything like that?
It's a linear trend line. All right, this is a historical look at our cash, accounts receivable, and accounts payable, starting with July of 2011. And I stopped there just because I didn't have any information prior to that to put into the chart. Top line is accounts receivable, middle line is accounts payable, and the bottom line is cash. So you can see back in July of 2011, this is when we started to get hit by the Medicaid payment delays. We basically had no cash. And so what did we have to do? We had to hold off on payables. So our payables went from $2.4 million to $3.6 million by November. Accounts receivable, no surprise because Medicaid wasn't paying us, and we were not getting IGT payments for over 2 years by this point in November of 2011. Our receivables were up to $4.6 million. We got an over $2 million payment in December for our outstanding IGT revenue. And plus we were able to get on the expedited list for Medicaid payments. So our Medicaid payment delays dropped from 6 months to 3 months. So we were able to pay down our receivables by about $1.2 million. I'm sorry, yeah, our receivables dropped by $1.2 million, and our payables we paid down from $3.6 million to $1.6 million. And you can see our cash had gone up. And so over the course of this current year, we've slowly seen our drop in cash, but right now, as of September, and again, it has helped because we got an extra Medicaid payment in September, we're at just about $1 million through September. Now, one of the things that we are starting to do at MPA is we're going to do a monthly cash projection because I am definitely afraid that we're going to see Medicaid payment delays starting next year. So we're going to keep a very close eye on the monthly cash balances, and we're going to project out what our cash needs are going to be going into 2013. What I can tell you is we preliminarily got this through the end of the year. We should, in December, before the tax anticipation warrants are received, we're going to be over $1 million. We should see our cash balance increase through December. And I'm taking an educated guess that by January, February, we should be at about at least $1.5 million, if not 1.8 million cash by then. So, relatively speaking, our cash situation in July or this year compared to last year at the same time is significantly improved. Now, am I happy with this cash balance of $1 million? It's still no. It's still very low. But relatively speaking, this is a significant improvement in the cash situation with the nursing home. But still very tenuous if we face additional payment delays. Any questions on this chart before I? Yes, sir.
How far out are the receivables, I mean the payables right now? Pardon me.
Roughly 2 to 3 months. Not every vendor. Some are current, some aren't.
You think with anticipating having a little more cash the first of the year, maybe we can get into the 60-day mark on a lot of those?
Because I believe that we're going to see
You're
additional
not going to do
payment
that,
delays.
you're still going to stay at 60?
All our vendors are happy right now with, because they're seeing regular payments. So I don't want to play catch up because 6 months from now, we may have to delay it, and I'd rather keep them where they are right now. Any other questions? All right, so what's going to happen with our government payer rates? Medicare. So again, I had stated that we had a 1.8% increase in October with Medicare. Well, obviously, as soon as the election was over, the next day everyone's talking about the fiscal cliff. Now, if there's no deal, we would see in January a 2% decrease in our Medicare rates. So the only good news to that is that would equate to only a $53,000 loss for us. We can weather that storm without any problems. Medicaid rates, we're not going to see any increase until January 2014. But again, with the new Medicaid reimbursement system that would go into place at that time, we would see an annual increase of at least $500,000 in Medicaid revenue. We just had a conference call with our nursing home association, and they're going to see if it's possible to get those rate increases sometime in 2013. But again, I'm not holding my breath. But it is in the SMART Act that we will see new rates as of January 2014. Cash flow. This is the big unknown. What I've heard so far from associations is that there should be no changes through the rest of calendar year 2012. So right now, we're basically 2 months in arrears in payments because of the extra payment that we received in September. Is it going to stay that way? I hope it does. But I've been told that we're going to see regular payments through December. Now, what happens next year? The other information that I'm hearing is that the savings that have been anticipated with the SMART Act are not showing up. And they're going to fall significantly short. And if that is the case, we will see payment delays because how else is the state going to pay the bill? They don't have money to do it, so they're going to have to do payment delays. Come budget time, they're going to start hammering us for additional rate cuts. So the same thing that we talked about earlier this year, I'm going to be talking to you guys about in 2013. Now, we've got a lot of things changing in the marketplace. And I'm calling it opportunities because I truly believe these are opportunities for Champaign County Nursing Home. This first one, the Illinois Dual Eligible Managed Care Demonstration Program. The state of Illinois wants to put anyone who is a dual eligible, and that is anyone who is covered by both Medicare and by Medicaid. The state wants to put all those individuals into a managed care program. The demonstration program is going to get rolled out sometime in 2013, probably not till the fall. And it's being rolled out in the Chicago area and central Illinois area, which basically starts with Champaign County and goes up towards Rockford. They've just selected 2 health plans for the central Illinois area. They are Health Alliance and Molina Healthcare. The nice thing about that is we have a very good working relationship already with Health Alliance, so I think that's going to help us tremendously. But that is going to be a significant change in how we do business. The other item, and I'm going to talk about that in a minute, the other item is reducing hospital readmissions. We've been working with the hospitals, both Praveen and Carl, to reduce their hospital readmission rates. So that's anyone that comes to us from one of the hospitals but ends up going back to the hospital in less than 30 days from when we receive them. All the hospitals, both hospitals are seeing Medicare payment penalties because their readmission rates are too high. And so we've been working to, first of all, identify what our readmission rate is, identify potential ways that we can reduce readmissions so we can keep them in the nursing home. And if we can show that to the hospitals, the goal is we will be rewarded with more Medicare referrals. So the goal is, both of these programs, is to save money, both for federal dollars and state dollars. But the goal is also to improve quality of care with coordination of care between the various service providers. So this is a huge opportunity for skilled nursing facilities that can show good outcomes and control their costs. And again, it's a huge change in our incentives. So what am I talking about with incentives? Right now with Medicare, what we want to do is maximize how long someone is on Medicare as much as possible without getting into trouble with the feds. So I'm not saying about doing anything illegal. What legitimately we can do to take care of those residents, but we want to keep them on Medicare as long as possible. Because again, Medicare pays us on average about $500 per day compared to private pay at $180 or Medicaid $150. So it is in our best interest financially to keep them on Medicare as long as possible. Along with that is rehab is a big driver of our per diem or our rate. So the more rehab that is done, the higher our average Medicare rate is going to be. And no surprise, we want to increase the number of Medicare residents that we are taking care of in the facility. Under managed care, we're going in the opposite direction. Under managed care, if we are in what's called a capitated plan, the state and the federal government is going to pay Health Alliance a fixed rate per member per month, and it is up to Health Alliance to be able to take care of you under that fixed rate. What does that mean? They want to keep them out of the hospital, if possible keep them out of the nursing home, and hopefully keep everyone at home, but we know that's not going to take place. So, if they go to the hospital, get them out of the hospital as quickly as possible. Hopefully send them home, and not send them to the nursing home, but if they go to the nursing home, they want to send them home as quickly as possible. So what does that mean? It means that the incentive for the health plan is going to decrease our Medicare length of stay. They don't want to see a lot of therapy. They want to try to reduce the intensity of therapy while still maximizing the outcomes for that resident. So they want to still get those people home, but they don't want us doing therapy 5 days a week. They want us to do it 3 days a week, 4 days a week. And they also want to make sure that if we get a hospital admission, they don't want to see that patient going back to the hospital the next day, the next week, the next month or so. So, what this means is that our average revenue per resident will decrease over time in the managed care program. So in that previous chart, when I saw that our average revenue per day, that's going to continue, if not accelerate. So the only way to make up for that is we got to increase our Medicare market share by showing Health Alliance, showing Molina Healthcare, and showing the hospitals that we do a really good job of taking care of these residents in the most efficient manner, and hopefully better than the other facilities in there. That's the managed care game.
Scott, with that said, but right now we're having a problem getting those folks in, so do you think that's really gonna change by what you're saying? I mean, you're in strong competition if that comes across for everybody.
One of the things that is going to help us is the fact that there are providers in the community that are very reluctant to take Medicare. So now when you're talking about someone who's covered by Medicare and then we convert to Medicaid, we've already been talking with Health Alliance. They see us as a primary nursing home provider under this demonstration program. So I think over time, I believe that it's very possible for us to increase our Medicare book of business.
And when do you think all this is going to start occurring? April, May?
It originally was supposed to start on January 1st. It's been pushed back to April. I don't think it's going to start until October at the earliest. At the earliest. It may not start until 2014. But officially right now, the start date is April 1st, but there's no way that's going to take place. Because the state was supposed to select the health plans back in October. It just did a week and a half ago.
They're good at that.
Yeah. They still need to get federal approval to participate in this program. They don't know when that's going to happen. Then the state has to turn around and negotiate the rates and put the policies together of how the health plans are going to operate. And then the health plans have to turn around to us and say, this is how the game's going to work. It's all up in the air.
So Scott, so that means you won't be able to take individuals from Medicaid or Medicare anymore. You'll have to go with this middleman system.
Yes. Now, individuals can opt out and stay within the fee-for-service. But I believe it's going to be, you have to actively say that you're going to be out. If you don't say anything, you will be put into one of these managed care plans. I believe that's how it's going to work. Yes, yes.
What do you project, if you can even do that, Medicaid census as a percent of total census is going to be going eventually? Where will we end up?
I have no idea. I have no idea. But I know where you're getting at. But right now, obviously based on what we've seen in September, I mean, our Medicaid census has gone up this year. It's helping the bottom line, without question. But it depends on what the Medicare mix and the private pay mix. If our Medicare was 4 or 5 residents, and we're at 60% Medicaid, we wouldn't be showing a profit. But because the Medicare has gone up a little bit to the, to the teens, we're okay. So we're always going to be playing that game. And I can almost guarantee you that I will be having discussions with the board of directors and with all of you that at some point in time, we are going to have to take a look at actively controlling the number of Medicaid residents in the building. You'll have no choice. I call it, well, Mike and I always said, no margin, no mission. You can't take all the Medicaid and save the county. You can't. But we still are taking a significant portion of the Medicaid population in the county. Again, because there are other providers that won't take it. There are other providers that once you use up your Medicare days, we're getting a phone call saying, hey, will you guys take this person?
The cutoff mix would be then, where are we in an unsafe potential area?
Again, it depends, it varies between a number of private pay and Medicaid. But I'd say there's no way we could handle a sustained 70% Medicaid census. Could we go to 65%? Maybe.
But that's as long as if you had
Enough Medicare.
enough Medicare. So you
And
have to
private
ensure
pay.
that there's enough Medicare and
Right.
private pay in order to increase, because we're at 57, almost 58% right now.
Right. So now, I can tell you that when we get inquiries, and they may be Medicare going to Medicaid, we take a hard look at those. Because if they have high costs associated with them, we will tell the hospital that we can't take it. I mean, if they have behavior problems, we're not going to take it, because that's too disruptive to our population. But we are already taking a look. All the nursing homes do that. can we effectively take care of these residents without breaking the bank? Everyone's doing that. Some homes take it to the extreme where they won't even take any medication when it's possible. But we will at least look, and in most cases we'll take, but we are actively looking to make sure that we're not going to lose our shirts when someone's going to be at high cost. Now, under managed care, here's again an opportunity. In the hospital, it's costing $2,000-$3,000 more a day to keep that person in the hospital. So let's say they have a high-cost antibiotic, so it costs $500 a day. Even with our pharmacy contract, we could lose money on that deal. But now it's in the best interest of the health plan and the hospital to say, well, maybe we'll give you the antibiotics, even though it's going to cost the hospital an additional $500 a day. But they're still saving because we're getting paid $500 a day as opposed to the hospital incurring costs of $2,000 to $3,000 or more a day. So we've already started having those discussions with the hospitals, but with the managed care umbrella, they're really going to start listening and taking a hard look at doing those types of arrangements. So that would make it easier for us to take more Medicaid, if that's the case. So a lot of things that we've talked about before, the renal dialysis, respiratory therapy, those really do help us position Champaign County Nursing Home to operate in the managed care. Respiratory therapy will help reduce readmissions because the number one and two diagnoses that we see are congestive heart failure and pneumonia. And those are the top two diagnoses that get sent back to the hospital very frequently. Renal dialysis, I'm still working on the RFP. We received a response, one response to the RFP, and I'm going through the analysis, and we'll be presenting that to the board of directors in December, and we'll be hearing the result of that soon thereafter. Medical management and nursing case management. Those are internal issues that we're dealing with. Medical management is basically working with our physicians and our nurse practitioners to improve the medical management of our residents. Nursing case management, what that is that in general, we get so busy on a day-to-day basis, especially the nurses, that we need someone to quarterback and coordinate care of our residents from the time that we get them from the hospital, making sure that we have all the information from the hospital, all the information from the patient, families, and that case manager or that nurse will be responsible for quarterbacking and coordinating the care of that resident while in the facility. Lab tests will work. They're going to make sure that those lab tests get followed up on, communicate with the physician, following up with the doctors, following up with the families, whatever it takes, making sure nothing falls between the cracks as much as possible. Because right now, the staff nurses are just pulling their heads out of the plane because these patients are much sicker than they were in the past, and they are lucky to get everything done in our day. So what does that mean? Well, what that means is, it is possible that I'm going to add more nurses. I've already been talking to Karen about this and whether it's something we need to do. I haven't pulled the trigger on it, but I believe that it may be a worthwhile investment to put on what I'm going to call these case managers to oversee the care. If we can reduce readmissions and keep our census up, the hospital can see that we're doing a better job. They're going to send us more referrals, and we will more than cover those costs and improve the bottom line. Again, the focus is always going to be on improving resident care. That's our core business. So we got to do a better job of taking care of these residents than we've had in the past. We've made improvements, but there's still a long way to go to improve the resident care. And working with the hospitals and the health plans will put us in a very strong position to be successful. Even though we're seeing our rates being cut, we still have opportunities to increase our volume in this new environment. Any questions?
Scott, what's the status of the administrator position?
I am finalizing the benefit package, and hopefully December 1st is when we're going to make the official move.
Thank you.
Other questions for Scott? Go ahead, Walter.
Well, the last time you were before us, other data I'm interested in are getting so we can have a better understanding down the line. It's nice to see the census up, but when the census goes up, there comes a point of diminishing return in the relationship to cost and handling that increased census. And I asked about projections about that the last time, and I think it would be very good for us to understand and see those projections, and with various assumptions in relationship to those projections. They could be all Medicaid, they could be Medicare, they could be private pay, and so as we think this through as to how to stabilize the nursing home, we need more of these figures, and you've given us many assumptions about what may be happening down the line. It would also be helpful to see some of those played out in the figures and what this means in relationship to the kind of mix that would be useful for this nursing home, so it gets, each month progresses to a more and more stable bottom line figure. And then in the documentation, I noticed food costs are going down, yet census is going up. That seemed to be somewhat of a mismatch. How is that happening?
Well, food costs per day are going down. Now, because we need to be, in general, under $6 a day. And so we've been pretty consistent. There's always going to be fluctuations every month. But that's where we need to be. So, in general, as the census goes up, food costs should go up. But there's always going to be fluctuations that go along with it. But what I look at, because the census varies, is what our food costs per day. Same thing with labor costs per day, non-labor costs per day. So,
And that's per person.
per person, right. So, food costs right now are in line, and I'm not worried about them. But we keep a close eye on it because food costs is a huge cost item on the non-labor side. Now, back to your original question about what's the target, I'm paraphrasing, where we need to be profitable, or are there going to be diminishing returns?
Right.
In general, there's no diminishing returns. If we can fill every bed, we're going to be okay, as long as we don't go crazy and put too much staff on board. Internally, they keep a very close eye on the staffing, and they will adjust staffing as the census goes up. And staffing is what I always call a semi-variable cost. If our census goes up by 1, we're not going to have another CMU in the nurse. But it may take an increase in census of 4 or 5. And it depends on where in the building. If it's scattered across the entire building, you may not have to increase our staffing. But on a Medicare unit, if you go from 10 Medicare residents to 15, we may have to put on another CMU. So there's a lot of variables that go along with it. But what I can tell you is that they keep a very close eye on staffing compared to the acuity and the number of residents that we have in the building. But in general, the more residents, the merrier, because if we're at 180 or 210, we still have the same fixed costs because we can't reduce the number of hours for the administrator. We still have to have the D1, we have to have the AD1. Those are fixed labor costs, and we still have fixed non-labor costs. And the higher the census is, the more we can spread those fixed costs over more residents. And that's why you see our cost per day over the last few months has dropped significantly down to below $200 per day because our census has gone up. So in general, I'm not worried as the census goes up because our average cost per day should drop. Now, if our census goes up and we go from $200 per day to $220 per day, now we're going in the wrong direction.
So the staffing situation in this fluctuating time, the census is filled by contract staffers, is that correct?
Well, we're trying to do it with our staff as much as possible. And so over time, as you can see, we've been able to decrease our reliance on agency, but we're still averaging $50,000, $60,000, $70,000 a month over the past few months. So it's a lot better, but I'd love to be able to get that down to zero.
Scott, so I want to make sure your answer to Pat's is clear. You're saying that the marginal cost of patient number 211, 12, 13, 14 that we are adding, even if it's Medicaid or even private pay, which in general we're using a slight amount of money on, is revenue positive.
Yeah. And I think what you've seen in September shows that, because we've seen an increase in Medicare, but we've seen an increase in Medicaid at the same time. So adding more Medicaid actually hasn't hurt us, that's helped us because of that marginal increase.
So Scott, first of all, just for the board, I think more than anything, think about this moving forward. This is a lot of detail. How many of you get it all? I don't. How many of you are exhausted by all of this detail? I am. We have a nursing home board for a reason, and the best decision that we ever made was bringing on professionals to help us. I think it's the best decision we ever made, and we made it 2 years too late. Otherwise, the numbers would have been a hell of a lot better if we had done it when we first thought about doing it. You've done an excellent job. This is so much detail. We have to lean on the nursing home board to provide that level of expertise for a decision-making body like ours. The big concerns I have are increasing census, that's good. Decreasing contract nursing costs is excellent because it was a huge concern in the past. Concerns, though, are we went from, when I started on this board, we introduced along the way tax anticipation warrants and then revenue anticipation warrants. And then the state was late, but they paid up. And so things are still tenuous. Not because of any fault of yours, thank God you're here telling us how to do this. But for the next board, empower them to do their job, keep a close eye on, but don't micromanage this stuff. Let the nursing home board and our professionals that we hire tell us how to do this. Real concerns going forward are how are we going to pay for that laundry list of renal dialysis and everything else when we as a board in the past have made the commitment to not spend any more on this, right? We said years ago, this operation has to be self-sufficient, but we don't have a contingency plan, do we? Real contingency plan, because renal dialysis will cost us some dough that we don't have to do. I'm not here to tell you how to do it, but that's what the next board has to think of. You've done a terrific job. I really appreciate all the work you've done over the years to save our home. But we're at a crossroads right now, and we have to really think about what that next phase looks like, and that's for the next board to do.
Other questions for Scott? Thank you, Scott.
Thank you, everybody.
Motion to accept place on file.
Place on file, receive place on file.
Second.
Second, Mr. James. All in favor?
Aye.
Opposed? Motion carries. Next up, we have adoption of the 03-69. Mr. Dunn, would you read that, please?
Oh, I'm sorry. I'm sorry, you're so moved.
Oh, no, you have to read it. Sorry.
Checked out.
Bear with us, our paper's stuck together.
What exactly, are you wanting me to read this to go into executive
Switch
session?
adoption of the agenda item.
Oh, okay, I'm sorry. She said executive session, that's what I was really confused. Okay, then I misunderstood you anyway. Okay, yeah, I move adoption of a resolution number 8369, amending the nursing home board of directors bylaws. That's what I moved.
Second, Mr. Getz, discussion.
Yes, I move to amend this resolution, referring to page 2, the paragraph, the last paragraph that starts with "be it further resolved." And I would like to remove from that paragraph, third line, beginning with the quotes, annually, the Champaign County Board shall review the progress of the mission and purpose of the home under the direction of the Board of Directors.
Second.
Second by Mr. Monson. So effective says that we're gonna have an annual review.
Yes,
Okay.
that is correct.
Patsy, would you say what page I was on?
So on page 2 of the packet,
Page 2, she wants to move the line annually, the Champaign County Board shall review the progress of the admission, purpose of the home, and the direction of the board of directors. The resolution I stated out takes out that annual review, this would leave it in there. Particularly, we have that with the annual report. Discussion on the amendment. All in favor? Oh, sorry, look, just a minute.
Don't see why we need it. I mean, the board can do whatever they want whenever they want, so I don't understand the value of the amendment.
It just says occur on an annual basis if they want to. I mean, we have it right now, and we have an annual review. The board can do it how they want to. Suzanne?
I'll just speak to that issue. I think Mr. McGinty pointed out that the new board has to do some other determinations with regard to the nursing home. However, one thing that was brought up in our CAL, which brought us to this point, is Ms. Petrie's review of the bylaws, which hadn't been reviewed by this board and kind of went unnoticed. And so I think that this will put it into an effective process so that it is part of our annual review, or the board's annual review, just like we do budget hearings and everything else, and it should be included officially and not overlooked as the bylaws.
Further discussion? Okay, all in favor of the amendment? Aye. All opposed?
Aye.
The amendment fails. Back to the main motion. Discussion on the main motion. All in favor of the main motion?
Aye.
All opposed?
aye.
Motion carries. Next up is the Rural Transit Advisory Group presentation. Why don't you go ahead and get started?
Sure. Thank you very much for the few moments that we need to make this presentation. I promise that it will be informational but brief. Criswell Mass Transit has been in operation now. We're in our second fiscal year. And where do I point this to? Okay. Okay, so we have been funded to provide rural transportation, demand response, curb-to-curb transportation for the rural areas of Champaign County. We've been in operation for 3 years. That was taking place through a very formal primer process, and Chris was selected as the system operator. The RTAG was established and meets quarterly. The bylaws require a November annual report, and that's why I'm here today. And we feel very fortunate to have your board member, Stan James, as the county liaison on the organization. He's very busy with all of that. Champaign started the service in February of 2011, and as a result of our relationship with RTAG, we developed an intergovernmental agreement with the county as the grantee, Chris as the operator, and CCRPC as the fiscal oversight and the facilitation organization for RTAG. The service is focused, because of the primer process, in the area that was identified as the neediest. And that area was designated as Rantoul, Ludlow, Thomasboro, and Gifford. We additionally have a small grant to provide transportation to senior citizens, and that is county-wide in the rural areas. So any senior in the county that's registered with us can get very affordable transportation into the Champaign area or anywhere around the county. And that's for adults 60 years of age and persons with disability and veterans, our primary riders. Champaign County Nursing Home is an additional contract that we have, and we provide service within the urban area for transportation, typically for medical rides. The RTAG approved our 2012 annual report. You have a copy of that in your packet, and the state fiscal year is obviously from July to June, and your tan handout outlines all that. If you have any specific questions, I'm happy to answer that. We anticipated, I guess the good news is we anticipated providing approximately 8,000 rides between the beginning of our service and now. Did we jump ahead there, Haley?
Sorry,
That's
it just
okay.
says in milestone.
We anticipated that we would provide 8,000 rides in the time that we have been established. However, we have actually provided 17,650 rides. We would have never guessed that our ridership would be as high as it was, or we would be able to even facilitate numbers. But we just have very good staff, fortunately, and a community that's very interested in partnering to provide the ride service. So 830 different people actually have used our service to make up those rides. The total riders Chris registered included approximately 40% of the general public, meaning that 10% of those persons that ride are people with disabilities, and 24% are seniors, 18% are actually Champaign County nursing home residents. As previously verbally reported, we have the trend statistic in there, which is the handout that looks like this. And you will see that we have a very steady increase in ridership, and the rides are, however, leveling off. And we won't see an increase in ridership because capacity-wise, equipment-wise, it's physically impossible to provide more rides than we currently do. As I said, it's amazing that we're able to pack them on the buses the way that we are, but the riders are very willing to share the rides and wait for each other so that we can provide as many rides in and out of the community with as full buses as possible. So that's the leveling up. Is that you? Yep, that's the end.
You already said the one about August.
Pardon me?
You already said the August milestone.
Oh, sure, okay. So the August milestones, we had 54 rides a day in Champaign County, surpassing IDOT's set goal of 50. And that 50 that IDOT sets is based on the size of the community, the area that we're spanning as far as mileage, and the number of vehicles that we have available. So we're just very proud to surpass all that. The highest average per day is 74 rides a day. It's a very, very busy day in the transit business in the rural area. And in December, Rural Rider Program changed the name to the Senior Passport Program. That's a new term that you'll begin to hear out there in the community. And you can find our quarterly RTAB reports online, and the address is in your handout. And of course, as far as following all the rules for fiscal reporting, the Chris Governing Board fiscal reports can be found on our website as well. Yes, sir.
I just had a question about what kind of data you keep on the ridership. I found that knowing that the number of distinct riders as opposed to the number of rides is very useful. Do you know who is riding it? I mean, could you determine how many of each of those 830 people, how many times they use the system?
Yes.
Okay.
Yeah, we do collect that data.
Yeah, because that could be very useful to give you an idea whether it's people. I mean, it's like, did the math, it's like 21 rides per person, which indicates to me that either, but I doubt it's flat, right? I assume some people are using it all the time, and some
You're
people
right.
are using it once, so it'd be useful to know what that distribution was.
Sure. Some people may use it to go to work every day or go to adult
I was kind of
daycare.
surprised to see the number was that low, because I envisioned that, I assume there are people out there who essentially use it every day, but obviously probably people use it once or twice a year.
You're right.
It'd be interesting to see that, that might help give you an idea of what additional uses you might be able to market the service for.
Yes, that's a good point. Anything else?
You've indicated to us that you're at basically a maximum of servicing the potential population due to equipment. Have you done any projections that if you add some additional equipment, how many more individuals or rides could be serviced? And if so, then taking it to the next step, you have been planning get more equipment?
Yes, ma'am, we just submitted, well, actually, by the end of the week, we're submitting a new grant, and we anticipate adding approximately 5 new vehicles to our fleet if the grants are funded. In addition, I feel very fortunate to have secured additional vehicles through the Veterans Administration. They're actually going to pass some vehicles through their administration to our organization to increase the ridership for veterans in the area.
So 5 more vehicles in your projections will allow you to service how many more population?
Close to half of that, because the ridership will be spread out much wider in the rest of the county. We won't be concentrating just on the North County. We'll be adding, of course, the other 3/4 of the county, so the mileage will increase. And the focus of the additional funding that we have requested is specifically for medical rides. And because we consider that the priority, and our funders consider that the priority. Those rides typically are slower to load,
Yes, I
and
understand.
so we just
That'll
can't.
be longer distances that you'll have to be going.
Yes, ma'am.
Okay, thank you very
And
much.
more wheelchairs.
And Amy, you might want to tell her, even though you applied for the grants, how long it would take before you would actually get the
Yes, thank you. When you apply for a grant for a vehicle, and you actually receive a yes on it, then they put an order in to have the vehicle manufactured. So we're looking at 18, even 24 months out to even receive a vehicle. So transit is a very slow-moving growth process, but we're doing everything right here locally to do that.
So the flyers aren't being put out right yet?
I passed them out last week.
Further questions?
Thank you.
Second.
Second by Mr. King, all in favor?
Aye.
Opposed, motion carries. Next up is Eli, Mr. Kurtz.
Thank you, Mr. Chair. We have two items on the agenda tonight. I move to approve ordinance number 912, amending the zoning map to change the designation from R4 to Ag 2 on the property at 709 North Prairie View Road, Mahomet.
Second.
Second by Mr. J. Just quickly before discussion, the committee voted to recommend approval of this rezoning for the proposed expansion of the Sangamon Valley Public Water District treatment plant, which the Zoning Board of Appeals recommended for approval. ZBA also approved a special use permit for this expansion, and the Water District submitted a summary of needs summarizing the importance of the expansion. The Village of Mahomet has submitted a formal protest against this rezoning. Therefore, there's 21 affirmative votes are required for approval. Is there any discussion on this motion?
Mr. Alex?
Yes, Mr. Alex.
I just want to make a comment that I was unable to make at the county because the discussion was cut short. I appreciate the Village of Mahomet having representatives here to answer some of my questions. I think that some of the comments made by the Village of Mahomet indicate that their protest was made in good faith, concerns about ability to annex surrounding parcels, concerns about street grid and so forth. But in the end, I think looking at this, the standard that the county board should apply for when we countermand the Zoning Board of Appeals, which is the official hearing body for these cases, is high. And although I'm sympathetic to some of Mahomet's arguments, I don't think that this has risen to that level. So I intend to support this.
Other discussion?
After some further explanation given to us at the Democratic caucus, I will vote yes this time. I voted no previously, but there seems to be movement toward an intergovernmental agreement, and that was one of the things that caused me to vote no last time. And so I'm voting yes in good faith here, folks. So I hope to see that happen.
Additional discussion?
Roll call.
We will have to have a roll call to these one votes.
Thank you.
Roll call.
Fitz,
Yes.
Carter,
Yes.
Howard,
Yes.
Esri,
Yes.
Olderfield,
Yes.
James.
Yes.
Jay,
Yes.
Kibler,
Yes.
Kurtz,
Yes.
Langenheim,
Yes.
Maxwell,
Yes.
McGinty.
Yes.
Michaels.
Yes.
Mitchell,
Yes.
Mosher,
Yes.
O'Connor,
Yes.
Petrie,
Yes.
Quisenberry,
Yes.
Richards,
Yes.
Rosales.
Yes.
Schrader,
Yes.
Alex.
Yes.
Emmons,
Yes.
Anderson,
Yes.
Bensel,
Yes.
Bergson,
Yes.
Weibel.
Yes, motion carries. Mr. Curtis, next ballot, please.
Second, I move to approve ordinance 914, amending the zoning ordinance by changing the definition of best farm farmland.
Second.
Second by Mr. Keeler. The committee voted to recommend approval of this text amendment that was recommended by both Lisa Update Committee and the Zoning Board of Appeals. This amendment will strengthen the zoning ordinance protection for the best farm farmland. It is based upon the updated Lisa that was approved on the consent agenda earlier this meeting. No municipality or township protests have been received, and 14 votes are required for approval of this text amendment.
Mr. Hall, clarify, we strict to get by the voice vote of the majority? Simple voice vote for this?
No.
What do you require?
Roll call.
Roll call for simple majority.
Yes.
Okay, thank you. Again, this is case 7/11/1812. Discussion on this item. See, no roll call.
Betts,
Yes.
Carter,
Yes.
Howard,
Yes.
Esri,
Yes.
Holderfield,
Yes.
James.
Yes.
Jay,
Yes.
Kibler,
Yes.
Kurtz,
Yes.
Langenheim,
Yes.
Maxwell,
Yes.
McGinty.
Yes.
Michaels,
Yes.
Mitchell,
Yes.
Mosher,
Yes.
O'Connor,
Yes.
Petrie,
Yes.
Quisenberry,
Yes.
Richards,
Yes.
Rosales.
Yes.
Schrader,
Yes.
Alex.
Yes.
Emmons,
Yes.
Anderson,
Yes.
Bensel,
Yes.
Bergson,
Yes.
Weibel.
Yes, motion carries. Thank you, Mr. Curtis. Policy, personnel, and permits. Ms. Evans.
Policy moves adoption of resolution number 8327, appointing Mary Hodson to the nursing home board of directors, term to leave 11/30/2014.
Second by Mr. Mitchell. Discussion. Mr. Bell.
I would like to speak in support of the choice of Mary Hudson. I think she's an extraordinary, talented individual. I think we'll be very lucky to have her service on the nursing home board. She has worked within the nursing home. She has a very strong background in personnel and human relations. She cares deeply about the patients and the community. Long-time commitment to county government. I don't think we could have made a better selection.
Additional discussion. All in favor?
Aye.
All opposed? Motion carries.
Policy moves adoption of resolution number 8328, appointing Dr. Robert D. Dominguez to the nursing home board of directors, term to leave 11/30/2014.
Second.
Second by Mr. Maxwell. Discussion. Seeing none, all in favor?
Aye.
All opposed?
Aye.
Motion carries.
From the consent agenda, policy moves adoption of ordinance number 917, approving the Champaign County Electricity Aggregation Program Plan of Operations and Governance.
Second.
Second by Mr. James. Ms. Busick, can you give the update on this, please?
Yes, this was thoroughly reviewed by legal since the committee of the whole meeting. And as a result of that review, Mr. Fletcher has determined that the county does not have the authority to assess a fee under the county's code. So if you look on page 112 of your agenda packet, under K, number 2, that paragraph has been stricken from the version you are being asked to approve this evening.
Questions on that? Go ahead, Mr. Wall.
Excuse me, so this, is that by state law that the county does not have the ability to implement this? Is there another way?
The county's code, by Mr. Fletcher's interpretation, does not give the county board the authority to levy this fee. The only way to address it is to ask the legislature to consider changing the county's code, which is something that we may want to do because there are a number of counties who are assessing this fee.
Ms. Peters?
Was Mr. Fletcher asked the question, since other counties are accepting this fee, and I'm assuming putting it in escrow, why he is advising us not to do it?
Other counties are assessing this fee. I don't have any reason to believe that they are putting it in escrow. And Mr. Fletcher talked with the state's attorneys from several of those counties who are assessing this fee. And I just think our state's attorney is very diligent.
Further questions, Ms. Peters?
No.
Mr. Carter?
Yeah. I think we need a whole bunch of questions on this. I read it entirely, and I tell you, it's a lot of stuff that, why didn't we have a more in-depth study of this?
Do you have a chance, we talked about this?
No. Unless I went to sleep. We haven't talked about it. This is a huge deal here we talking about. And I'd like to know some of these, like ICC, what are they deal gonna be with this? I'm not happy with them as it is.
The ICC is not involved in this.
Well,
Do you have a specific question, Mr. Carter?
yeah, on implementation procedures. You see that where it says,
What page, 113?
yeah. Well, what does that say up there? By ICC regulation?
Well, that says that it's according to the regulation. They're following regulations.
What don't we need to know? You finna ask people to put their own money out to pay these bills, but we really not looking at the consequences they're gonna be, when they do this.
I think the consequence will be the people who pay less, Mr. Carter.
Well, I know a lot of my constituents calls us, and they can't get nothing out of them. Like now, some of them suggested they should be people that you have to put on the ballot and vote on to get them in office. So don't tell me that we don't have some concern here.
Lies.
Mr. James?
Are you done, Mr. Carter?
Yeah.
Will this, because based on the projection that we heard that might come back to the county, is that going to do anything, or has anybody said, are they just going to keep that as part of their profit line, or is that going to change anything as far as the cost?
The rate will be that much lower.
Okay,
The
that's why.
residents in unincorporated Champaign County will pay that much lower a rate.
And just one quick comment to you, Mr. Carter, if I might. When this was brought up, you, the consumer, has the option of opting out of this if you don't want to participate, so you still do have some leeway there.
Mr. Jones?
But I just realized, did you take up with Mr. Fletcher the question of whether it would be, whether our ability to potentially collect this fee in the future, if the state legislation does change, would be impaired by us not including language in the enabling resolution here?
Only for this current bid. We could amend this in the future if
Okay.
we're granted the authority for the next bid cycle.
So he didn't think it would be necessary to have language in here that said, if the state, in the event that this county's code is changed to allow collection, we don't need to leave the door open in this agreement to collect that,
No, because we would be able to do it with the next cycle.
which is how many years?
18 months.
18 months, okay, thank you.
Further questions? Go ahead, Ms. Allen.
You said that the other counties in Illinois are following this, but Champaign County cannot based on the interpretation of
And the county's code does not provide county boards. And I would point out that
the county code from state law.
the state of Illinois county's code. And there's been a mixing of municipalities and counties in much of this purchasing. And the municipal code gives the municipalities the authority to collect the fees.
Mr. Mr. Richards?
So, Ms. Busey, from this, we think it's better to wait the 18 months than pass it now and wait until we can get legislation passed. That's what we're saying?
Well, if you leave this in now, you'll be assessing the fee, and your
Okay.
state's attorney is telling you that you don't have the authority to assess the fee.
Okay. So the state's attorney's office thinks we cannot revisit this until the state's ILC is coming to this change.
Correct.
Okay.
That's the opinion of your legal
Yes.
counsel.
Mr. Betts?
This is a contractual negotiation, as I understand. Cannot the parties contractually agree to the fee without county's code? The other question I have is, the enabling legislation that allows this aggregation, does it provide a avenue for collecting the fee?
I don't think so. Mr. Fletcher spent a lot of time in reviewing this issue because he knew how critical it was. And I understand what you're saying about the contractual issue, but it really isn't, because you decide tonight whether or not you're going to assess the fee.
Currently, in fact, it's deciding whether or not we are going to contractually make that a provision that we contract for.
No, it's a provision that goes into a bid document that becomes a fee that you then collect.
I'm not going to contradict the state's opinion, I'll vote.
Mr. Ellis?
I was just going to add, I think we'd be concerned about anti-kickback provisions in that case. I mean, a vendor could agree to presumably compensate the county, but doing that at the expense of the ratepayers, I'm guessing would probably be improper.
I guess I'm just a little concerned in the sense that if there's a county in Illinois who's also subject to the compiled statutes, I don't understand how they are able to assess the fee. And has there been any legal ramifications to them assessing the fee?
Not at this point.
Well, I don't know if they know that everybody's brought it to their attention.
Is there a particular, okay, I understand, because I think ultimately there is still an expense for the counties to provide education.
That is in your plan of operation governance, and we will recoup that cost. The cost of all of the efforts that went up to this point of putting this in place.
And there should be very few expenses from here on.
Right.
Mr. Carter?
You know, I think we owe our people a little bit more than we give them. Now, let's be honest about it. I don't have, Ambrose itself have problems with a lot of people. And we spend money giving them to help pay their bills, and some of it is not just, you know, it's a lot need to be looked at here, like Carol said. Why we, Mr. Fletcher, yeah, but he's not voting on this. We're the ones sticking our necks out for this. And got this set here, I'll probably be gone, but somebody else will have to be trying to figure out, even the opt-out program. It really don't say, you opt out, sometimes it look like where you going to opt to. It's just a lot of stuff in here need to be looked at. I'm going to be honest with you.
Mr. President?
I'd like to call the question.
Second question. Second.
All in favor?
Aye.
All opposed?
Aye.
The motion passes. This is too simple.
You know, must be paid up the table.
So, amendment as
Money
amended.
at the table.
The amendment as amended, all in favor?
Say that again, please.
Amendment as amended, we're voting,
Voting on the ordinance.
we're voting as amended.
I don't believe.
With that being struck
This is the
out.
main motion.
Okay.
This is the main motion, okay? All in favor?
Aye.
All opposed?
Aye.
Motion carries. Thank you, Ms. Evans. Finance.
Thank you, Mr. Chair. I recommend adoption of resolution number 8329 for payment of claims authorization, and I so move.
Second.
Second by Mr. Mosley, discussion, all in favor?
Aye.
All opposed? Motion
I
carries.
recommend adoption of resolution number 8330 for purchases not following purchasing policy, and I so move.
Second.
Second by Mr. Esby, you have a copy of that on the table. Discussion,
Just one, does anybody know what happened with the highway thing?
Yeah.
The requirement for a purchase order is $5,000, and I think delivery charges ended up being more than what were originally anticipated.
Okay, so it was a thought that it could be issued under the, it was issued without the PO,
Thought
because
they
it was
were
thought that it
ordering
would be under
something that was
5,000.
going to cost less than $5,000.
Fine, thank you.
further discussion,
Yes.
Mr. Mosley, I'm sorry, Mr. O'Connor.
I've often wondered, I don't recall this ever happened. What if we did vote no on these? What would be the next step?
Well, they wouldn't get paid, and then you would be in violation of, not paying your obligations.
I just,
Understand.
there's one on there that sticks in my craw, on a credit card at Jimmy John's. I think that's scandalous for a government agency to allow that. That's gonna be my last chance to say that.
We just need a receipt.
Thank you, Mr. O'Connor. Further discussion? All in favor?
Aye.
All opposed?
Aye.
Show of hands to approve. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. We have a majority.
Item number 3, I recommend adoption of resolution number 8331 for $2,000 to cover additional print material expenses from the law library, and I so move.
Second.
Second by Mr. President, discussion. Seeing none, roll call.
Betts,
Yes.
Carter,
Yes.
Cowart,
Yes.
Esri,
Yes.
Oldfield,
Yes.
James.
Yes.
Jay.
Yes.
Kibler.
Yes.
Kurtz. Langenheim.
Yes.
Maxwell.
Yes.
McGinty.
Yes.
Michaels.
Yes.
Mitchell.
Yes.
Mosher.
Yes.
O'Connor.
Yes.
Petrie.
Yes.
Rosemary.
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Ammons.
Yes.
Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Weigel.
Yes, motion carries.
Item number 4, I recommend adoption of resolution number 8332 for $3,000 to cover the surcharge expense that needs to be paid out through the end of fiscal year 2012 out of the clerk's office, and I so move.
Second.
Second by Mr. J. Discussion. Seeing none, roll call.
Betts.
Yes.
Carter. Cowart.
Yes.
Esri.
Yes.
Oldfield.
Yes.
James.
Yes.
Jay.
Yes.
Kibler.
Yes.
Kurtz.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGinty.
Yes.
Michaels.
Yes.
Mitchell.
Yes.
Mosher.
Yes.
O'Connor.
Yes.
Petrie.
Yes.
Rosemary.
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Ammons.
Yes.
Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Weigel.
Yes, motion carries.
Item number 5, I recommend adoption of resolution number 8333 authorizing amendment number 2 to the operating agreement with Aramark Correctional Services LLC for inmate food services at the Champaign County Correctional Center, and I so move.
Second.
Second by Mr. Moser. Discussion. I'm sorry, let's say it again.
I said that we just approve the rate increase to the spring.
I can't recall what this is.
Commissary. Commissary, good.
Commissary judge, correct.
One more question.
Yes.
Why does the juvenile snacks cost more than adult snacks?
We have different standards, apparently.
They eat
Further questions? All in favor?
Aye.
All opposed?
Aye.
Motion carries.
Item number 6, I recommend adoption of ordinance number 915, authorizing the fiscal year 2013 annual tax levy, and I so move.
Second.
Second by Mr. Betts. Discussion. Roll call, please.
Betts,
Yes.
Carter, Cowart,
Yes.
Esri,
Yes.
Holderfield,
Yes.
James.
Yes.
Jay.
Yes.
Kibler.
Yeah.
Kurtz.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGinty.
Yes.
Michaels.
Yes.
Mitchell.
Yes.
Mosher.
No.
O'Connor.
No.
Petrie.
Yes.
Quisenberry.
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Emmons.
Yes.
Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Weigel.
Yes, motion carries.
The 7th item, I recommend adoption of ordinance number 916, approving the fiscal year 2013 annual budget and appropriation, and I so move.
Second.
Second, Ms. Mitchell.
Give it to her.
Discussion. Ms. McGinty.
I would be remiss if I did not mention for one last time the work that our administrator and her staff puts into this every year. Anybody who's been here for a while knows how the budget process has evolved. We've reached a point where there are no questions by the time we reach this stage. There shouldn't be. We offer up so many different ways to digest the information now with a budget brief, with information online. We start how many months in advance? And every single month go over this. Leading up to this point, we ask every board member time and time again, do you have any changes? Do you have anything you want to add? And this is the work of Deb Busey and her staff. And it just is, it stands apart from anybody else in this state, from a county standpoint, how good she is at prognosticating where we're going to go, what we're going to need, how we're going to manage downsizing. Some people call it right-sizing. We did that in ways that were so special the last couple years. Painful, but still, I think, better handled than anyone in the state. And that's a credit to her. And this budget is, again, a work that is easy to digest, available to everyone. We've been incredibly transparent. Here, media, take it. What do you got? And that's the work of Deb. And I just offer up my thanks for all of the work that she's done for so many years at this, as we vote on this this small number tonight. Thank you.
Any other discussion? Roll call, please.
Betts,
Yes.
Carter,
Yes.
Cowart,
Yes.
Esri,
Yes.
Holderfield,
Yes.
James.
Yes.
Jay.
Yes.
Kibler. Kurtz.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGinty.
Yes.
Michaels. Yes. Mitchell.
Yes.
Mosher.
Yes.
O'Connor.
Yes.
Petrie.
Yes.
Quisenberry.
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Emmons.
Yes.
Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Weigel.
Yes, motion carries.
Item number 8, I recommend adoption of resolution number 8334, authorizing the issuance of tax anticipation notes for the county of Champaign, Illinois, and providing the details of such notes and related matters, and I so move.
Second.
Second by Mr. Benzel. Discussion. Betts,
I'll go back to this.
cash flow. They need the money. Cash flow. Not for you, Tom. Ms. Petrie, go ahead.
No, it's facetious.
All right, roll call, please.
Betts,
I want to vote no because I always vote no on something, but I got to vote yes.
Carter,
Yes.
Cowart,
Yes.
Esri,
Yes.
Holderfield,
Yes.
James.
No.
Jay.
Yes.
Kibler.
Yes.
Kurtz.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGinty.
Yes.
Michaels.
Yes.
Mitchell.
Yes.
Mosher.
No.
O'Connor.
No.
Petrie.
Yes.
Quisenberry.
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Emmons.
Yes.
Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Weigel.
Yes, motion carries.
Item number 9, I recommend adoption of resolution number 8347, approving the application for and if awarded acceptance of the Illinois Criminal Justice Information Authority's prosecutor-based victim assistance services program grant for Champaign County State's Attorney, and I so move.
Second by Mr. James, discussion. Seeing none, all in favor?
Aye.
All opposed? Motion carries.
And from the addendum, item number 10, I recommend adoption of resolution number 8370 for $187,700 to move budget dollars between personnel and non-personnel lines to cover nursing expenses at the nursing home, and I so move.
Second.
Second by Mr. Ezra, discussion. Roll call, please.
Betts,
Yes.
Carter,
Yes.
Howard, Esri,
Yes.
Holdfield,
Yes.
James.
Yes.
Shay,
Yes.
Bitler.
Yes.
Kurtz,
Yes.
Langenheim,
Yes.
Maxwell.
Yes.
McGinty.
Yes.
Michaels. Yes. Mitchell.
Yes.
Mosher.
Yes.
O'Connor.
Yes.
Petrie,
No.
Quisenberry,
Yes.
Richards.
Yes.
Rosales.
Yes.
Schrader,
Yes.
Alex,
Yes.
Emmons. Anderson. Benzel.
Yes.
Bergson. Weigel.
Yes, motion carries.
That is all for finance. Thank you.
Mr. McGinty. Next, let's do the minutes. Make the motion to approve the minutes of the regular county board meeting of October 18th.
Second.
Nice, that's all three. Move on to the minutes. Public hearing minutes of November 8th and the public hearing minutes of November 13th. Moved by Mr. Kimber.
Second.
Second by Mr. Gonzalez. Discussion. All in favor?
Aye.
All opposed? Motion carries. Okay. Mr. Betts.
I move that we enter into executive session pursuant to 5 ILCS 120/2 to consider collective negotiating matters between Champaign County and its employees or their representatives. I further move that the following folks remain present: the county administrator and the recording secretary. I so move.
Second.
Mr. Church, roll call, please.
Betts,
Dying to vote no on something, but I'm going to say yes.
Carter,
Yes.
Howard,
Yes.
Esri,
Yes.
Holdfield,
No.
James.
No.
Jay,
Yes.
Kibler. Kurtz,
Yes.
Langenheim,
Yes.
Maxwell,
Yes.
McGinty.
Yes.
Michaels,
No.
Mitchell,
Yes.
Mosher.
No.
O'Connor,
No.
Petrie, Quisenberry,
Yes.
Richards,
Yes.
Rosales.
Yes.
Schrader.
Yes.
Alex.
Yes.
Emmons. Anderson.
Yes.
Benzel.
Yes.
Bergson.
Yes.
Schrader, Weigel.
Yes, motion carries. First up, is there any new business? Seeing none, we're going to go on to the next item on the agenda, which is other business. Diane, you have the floor.
I move that we approve Resolution 8360. Resolution honoring retiring county board member Stephanie Holderfield. Whereas Stephanie Holderfield was sworn in as a Champaign County board member on December 6, 2010, and whereas Stephanie Holderfield has served the citizens of Champaign County as a representative of the Champaign County Board District 1 from December 6, 2010 until November 30, 2012. And whereas during her tenure as a Champaign County board member, Stephanie Holderfield served on the Committee of the Whole and on the following special committees: Labor, VAC, and Labor Management and Health Insurance Committee. And whereas during the tenure as a Champaign County board member, Stephanie Holderfield also served in a liaison position as the county board's representative on the Champaign County Convention and Visitors Bureau. And whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Stephanie Holderfield, who served the citizens of Champaign County as an elected official over the term of 2 years. Now therefore be it resolved that the Champaign County Board hereby recognizes the service of Stephanie Holderfield and the benefit that service brought to the county government. Be it further resolved that a copy of the resolution be presented to Stephanie in recognition of her years of service to the citizens of Champaign County.
Thank you, Mr. Chair. I'd like to move approval of resolution number 8361, the resolution honoring retiring county board member Ron Bensel.
Second.
Whereas Ron Bensel was sworn in as Champaign County board member on December 6, 2004, and whereas Ron Bensel has served the citizens of Champaign County as a representative of the Champaign County Board District 2 from December 6, 2004 until November 30th, 2012. And whereas during his tenure as a Champaign County board member, Ron Bensel served on the following standing committees: Highway and Transportation from 2004 to 2010, Finance from 2004 to 2006, County Facilities from 2006 to 2010, and Committee of the Whole from 2010 to 2012. And whereas during his tenure as a Champaign County board member, Ron Bensel also served in a liaison position as the Champaign County Board's representative on the Champaign County East Central Illinois Economic District and on the Champaign County Nursing Home Board of Directors. And whereas during his tenure as a Champaign County board member, Ron Bensel also served in a leadership role as the County Facilities Committee Vice Chair from 2006 to 2008. Whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Ron Bensel, who served the citizens of Champaign County as an elected official over a term of 8 years. Now therefore be it resolved that the Champaign County Board hereby recognizes the service of Ron Bensel and the benefit that service brought to county government. And be it further resolved that a copy of this resolution be presented to Ron Bensel in recognition of his years of service to the citizens of Champaign County.
Second by Mr. Jay.
You didn't know.
Ms. Maxwell.
I'd like to move to approve resolution number 8362.
Second.
Go ahead, Ms. Maxwell.
Resolution number 8362, resolution honoring retiring county board member Stanley Steve O'Connor. Whereas Stanley Steve O'Connor was sworn in as Champaign County board member on December 7, 1992, and whereas Stanley Steve O'Connor has served the citizens of Champaign County as a representative of the Champaign County Board District 4 from December 7, 1992 until November 30, 2012, and whereas during the tenure as a Champaign County Board member, Stanley Steve O'Connor served on the following standing committees: Budget and Finance from 1993 to 2002 and 2004 to 2010, Environmental and Land Use from 1993 to 1994, and from 2008 through 2010, Highway and Transportation from 1993 through 1998, 2000 to 2002, 2004 to 2010, Justice and Public Safety from 1995 through 1996, and 2003 to 2006, Personnel and Public Officials from 1996 through 1998, and 2000 through 2002, Policy, Personnel, and Appointments from 2002 to 2006, and County Facilities from 2006 to 2010, and served on the following special committees: Labor from 2000 to 2002. And whereas during his tenure as a Champaign County board member, Stanley Steve O'Connor also served in a liaison position as the county board's representative on the Workforce Investment Board, Community Service Block Grant Board, Development Disabilities Board, Muhammad Aquifer Consortium, and the Community Action Board. And whereas during the tenure as a Champaign County board member, Steve O'Connor also served in a leadership role as the Highway and Transportation Committee Vice Chair from 1996 to 1998 and 2006 through 2008. Personnel and Public Officials Vice Chair from 1996 to 1998 and 2000 through 2002. Policy, Procedures, and Appointment Vice Chair from 1998 to 2000 Budget and Finance Vice Chair from 1998 to 2000, and as the Ad Hoc Solid Waste Committee Vice Chair from 1996 to 1998. And whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Stanley Steve O'Connor, who served the citizens of Champaign County as an elected official over a term of 20 years. Now therefore be it resolved that the Champaign County Board hereby recognizes the service of Stanley Steve O'Connor and the benefit that service brought to the county government. And be it further resolved that a copy of this resolution be presented to Stanley Steve O'Connor in recognition of his years of service to the citizens of Champaign County. Presented, adopted, and approved, and recorded this 27th day of November, AD 2012.
Can I say a little something?
Let me say it first.
Oh, go ahead.
I want to finish.
Oh.
Stan, 54 years ago, this fall, you and I first met on the grade of I-74 at St. Joseph. We never imagined we would be here tonight together. And it is with a great deal of pleasure and a sense of honor that I am proud to present this plaque to you and to my dear.
He just shut me down. I was going to make a smart aleck remark. I wanted to tell Tom that the 99 years of experience that's leaving tonight is pale compared. Gary and I could make 2 phone calls and get you 217 years of experience on a survey crew. Thank you.
I move to approve Resolution 8363. Resolution 8363 honoring retiring County Board Member W. Stephen Mosier. Whereas W. Stephen Mosier was sworn in as a Champaign County Board Member on December 7th, 1992, and whereas W. Stephen Mosier has served the citizens of Champaign County as a representative of the Champaign County Board District 4 from December 7, 1992 until November 30th of 2012. And whereas during his tenure as a Champaign County Board Member, W. Steve Mosier served on the following standing committees: Policy, Procedures, and Appointments from 92 to 96, Personnel and Public Officials from 93 to 96, Policy, Personnel, and Appointments from 98 to 2008, Justice and Public Safety from 92 to 94, Environmental and Land Use from 94 to 98, 2000 and the year 2000 to 2002, 2004 to 2006, and 2008 to 2010. County Facilities from 1996 to 2000. Budget and Finance from 1998 to 2004 and 2008 to 2010, and served on the following Specials Committee: Labor from 2008 to 2010. And whereas during his tenure as Champaign County Board Member, W. Stephen Mosier also served in a liaison position with the Champaign County Board's representative to the Champaign Urbanized Area Transportation Study, Champaign-Urbana Public Health District, Extension, Education, Service Board, Regional Planning Commission, and Head Start Board. And whereas During his tenure as a Champaign County Board member, Stephen Mosier also served in a leadership role as the Environmental and Land Use Committee Chair from 1996 to 1998 and as Policy, Personnel, and Appointments Committee Chair from 2006 to 2008. And whereas, during his tenure as Champaign County Board member, Stephen led the county board as the county board chair from 1998 to 2000, provided leadership as the county board initiated the largest construction period in over 100 years, embarking on a project of construction of a new courthouse and juvenile detention center. And whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of W. Stephen Mosier, who has served the citizens of Champaign County as an elected official over a term of 20 years, sharing his dedication and commitment to the representation of agriculture and rural interests, and his expertise and experience in the management of the county's financial resources. Now therefore be it resolved that the Champaign County Board hereby recognizes the service of W. Stephen Mosier and the benefit that service brought to the county government. And be it further resolved that a copy of this resolution be presented to W. Stephen Mosier in recognition of his years of public service and leadership to the citizens of Champaign County. Presented, adopted, and approved this 27th day of November 2012.
Second.
Further, in honor of W. Stephen Mosier for your distinguished service as chair of the Champaign County Board, December 1998 to November 2000.
Point out that we haven't voted on any of these yet, so we remind that on this motion to vote on the one we've had so far. All in favor?
Aye.
Opposed? Motion carries. Okay, next up is.
Tom, that was your chance to vote on that.
Okay. I move the adoption of resolution number 8364, a resolution honoring retiring county board member Carol Ammons. Whereas Carol Ammons was sworn in as a county board member on February 21, 2008, and whereas Carol Ammons has served the citizens of Champaign County as a representative of the Champaign County Board District 5 from February 21st, 2008 until November 30th, 2012, and whereas during her tenure as a Champaign County Board member, Carol Ammons served on the Policy, Personnel, and Appointments Committee from 2008 to 2010, Environment and Land Use Committee from 2008 to 2010, and on the Committee of the Whole from 2010 to 2012, and on the following special committees: Parliamentary Procedures and County Board Rules and Strategic Planning. And whereas during her tenure as a Champaign County Board member, Carol Ammons also served in a liaison position as County Board's representative on the Champaign County Convention and Visitors Bureau, Economic Development Corporation, and on the county-wide MLK Committee. And whereas during her tenure as a Champaign County Board member, Carol Ammons served in leadership roles as the Parliamentary Procedures and County Board Rules Special Committee Chair from 2008 to 2010, Policy, Personnel, and Appointments Committee Vice Chair from 2008 to 2010, and Policy, Personnel, and Appointments Committee of the Whole Deputy Chair from 2010 to 2012. Whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Carol Ammons, who served the citizens of Champaign County as an elected official over the term of over 4 years. Now therefore be it resolved that the Champaign County Board hereby recognizes the services of Carol Ammons and the benefit that service has brought to county government, and be it further resolved that a copy of this resolution be presented to Carol Ammons in recognition of her years of service to the citizens of Champaign County, presented, adopted, approved, and recorded this 27th day, November 2012, signed by C. Pius Weibel, Chair, and Gordy Holton, County Clerk. Carol.
Second by Ms. Kohler. Yeah. All in favor? Aye. All opposed? Motion carries.
Oh, Carol. I do want to say that this has been an edifying 2 years sharing a desk with Carol Ammons, because she has a great sense of humor, but more importantly, she's taught me a lot. So thank you very much
Thank
for
you all.
that.
Thank you. I'd like to move resolution number 8365. This resolution is honoring retiring County Board member Janet Anderson. Whereas Janet Anderson was sworn in as a Champaign County Board member on December 4th, 2000, and whereas Janet Anderson has served the citizens of Champaign County as a representative of the Champaign County Board, District 7, from December 4th, 2000 until November 30th, 2012. And whereas during her tenure as the Champaign County Board member, Janet Anderson served on the Policy, Procedures, and Appointment Committee from 2000 to 02, Environment and Land Use Committee from 02 to 2010, and Justice and Social Services Committee from 02 to 2010. On the Committee of the Whole from 2010 to 2012, and whereas during her tenure as a Champaign County Board member, Jan Anderson also served in a liaison position as the County Board's representative on the Champaign County Mental Health Board from 02 to 2012, and on the Nursing Home Board of Directors from 08 to 2012. Whereas during her tenure as a Champaign County Board member, Janet Anderson served in a leadership role on the as the Humane Services Committee Vice Chair from 2000 to 02, as the Justice and Social Services Committee Vice Chair from 02 to 04, and from 08 to 2010, and as the Justice and Social Services Committee Chair from 04 to 08. Whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Janet Anderson, who served the citizens of Champaign County as an elected official over a term of 12 years. Now, therefore, be it resolved that the Champaign County Board hereby recognizes the service of Janet Anderson and the benefit that service brought to the county government. And be it further resolved that a copy of this resolution be presented to Janet Anderson in recognition of her service, of her years of service to the citizens of Champaign County. Presented, adopted, approved, and recorded this 27th day of November, 2012.
Second. Second, Ms. Kohler. Is that? All in favor? Aye. All opposed?
I have just a short statement. Dear Jan, it's been an honor and a privilege to serve with you over these past 4 years, sitting next to you. You have always been a classy lady and always prepared, always calm and poised. While I sometimes get a bit over exuberant, you were there to calm me down.
always there to be a mentor, a teacher, and a friend. You'll be missed by me personally, this board, and by our community that you've served for a decade, 12 years actually. You were always fair. Your stubborn commitment to what's right has always been a role model to me. But I know we will continue to be friends and a sounding board for future issues. Thanks for your service and friendship.
Mr. Chair, I move adoption of resolution number 8366, honoring retiring County Board member Brendan McGinty. Whereas Brendan McGinty was sworn in as Champaign County Board member on December 6, 2004. Whereas Brendan McGinty has served the citizens of Champaign County as a representative of District 9 from December 6, 2004 until November 30, 2012. And whereas during his tenure as a Champaign County Board member, Brendan McGinty served on the following standing committees: Budget and Finance from 2004 to 2010, Environment and Land Use from 2004 to 2006, Policy, Personnel, and Appointments from 2006 to 2010, the following special committees: the Administrative Structure Subcommittee from 2008 to 2010, the Strategic Planning Subcommittee from 2008 to 2012, and the Labor Committee from 2008 to 2012. And whereas during his tenure as a Champaign County Board member, Brendan McGinty also served in a liaison position as the County Board's representative on the Economic Development Corporation from 2006 to 2012, and the Regional Office of Education from 2008 to 2010. And whereas during his tenure as a Champaign County Board member, Brendan McGinty also served in a leadership role as the Finance Committee Chair from 2004 to 2010, Finance Committee of the Whole Deputy Chair from 2010 to 2012, Labor Committee Chair from 2010 to 2012, Administrative Structure Subcommittee Chair from 2008 to 2010, and the Strategic Planning Committee Chair from 2010 to 2012. And whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Brendan McGinty, who served the citizens of Champaign County as an elected official over a term of 8 years, now therefore be it resolved that the Champaign County Board hereby recognizes the service of Brendan McGinty and the benefit that that service brought to county government, and be it further resolved that a copy of this resolution be presented to Brendan McGinty in recognition of his years of service to the citizens of Champaign County. And it is my pleasure to add that Mr. McGinty, during my short term on the board, has been a terrific source of encouragement and leadership and support. It's been a pleasure to serve with you.
Say no, Bets. You know. Just say no.
I'll leave it back there. I am very pleased to move the Resolution 8367 honoring retiring County Board member Thomas E. Betts. Whereas Thomas Betts was sworn in as a County Board member on January 16, 1996, and whereas Thomas Betts has served the citizens of Champaign County as a representative of the Champaign County Board District 8 from January 16, 1996 until November 30, 2012. And whereas during his tenure as a Champaign County Board member, Tom Betts served on the following standing committees: Budget and Finance from 1996 to 2006 and 2008 to 2010, Environment and Land Use from 1996 to 98 and 2000 to 2002, Policy, Procedures, and Appointments from 1996 to 2002, Policy, Personnel, and Appointments from 2002 to 2010, County Facilities from 1998 to 2002 and 2006 to 2008, Committee of the Whole from 2010 to 2012, and then the following special or subcommittees: Labor from 1998 to 2002 and 2008 to 2012, Administrative Structure from 2008 to 2010, Strategic Planning Subcommittee from 2008 to 2012, and whereas During his tenure as Champaign County Board member, Tom Betts also served in a leadership role as the Policy, Procedures, and Appointments Chair from 2000 to 2002, Policy, Personnel, and Appointments Chair from 2004 to 2010, Budget and Finance Vice Chair from 2000 to 2002, County Facilities Vice Chair from 2000 to 2002, Labor Committee Chair from 2002 to 2004, County Facilities Committee of the Whole Deputy Chair from 2010 to 2012, and is Vice Chair of the County Board from 2006 to 2012. And whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Tom Betts, who served the citizens of Champaign County as an elected official over a term of 16 years. Now, therefore, be it resolved that the Champaign County Board hereby recognizes the service of Tom Betts and the benefit that service brought to county government, and be it further resolved that a copy of this resolution be presented to Tom Betts in recognition of his years of service to the citizens of Champaign County, presented, adopted, approved, and recorded on the 7th day of November.
Is it accepted?
We're going to call the vote first. We're going to call the vote.
All those in favor? Aye. Those opposed? Aye. Get that vote. Thank you.
Congratulations, Tom. It's been a pleasure serving with you.
It has been a total honor to be here. Thank you.
Next up, Mr. Betts.
God, I'm officially Thomas instead of Tom tonight. That's wild. When I was first on this board, I could see a whole lot better. I move resolution number 8368, a resolution honoring retiring county board member C. Pius Weibel. Whereas Pius Weibel was sworn in as a Champaign County board member December 6, 2004, and whereas Pius Weibel has served the citizens of Champaign County as a representative of the Champaign County Board District 7 from December 6, 2004 until November 30th, 2012, and whereas during his tenure as Champaign County Board member, Pius Weibel served on the following standing committees: County Facilities from 2004 to 2010, Highway and Transportation from 2004 to 2006, Finance Committee from 2006 to 2008, Policy, Personnel, and Appointments from 2008 to 2010, Committee of the Whole from 2010 to 2012, and the following special committee: Public Aid Appeals Committee from 2006 to 2012. And whereas during his tenure as Champaign County Board member, Pius Weibel also served in the liaison position as the County Board's representative on the Champaign Consortium Community Services Block Grant Board, Champaign-Urbana Public Health District, Muhammad Aquifer Consortium, Martin Luther King Committee, Lincoln Heritage RC&D, Regional Planning Commission, Liquor Advisory Commission, and Regional Office of Education. And whereas during his tenure as Champaign County Board member, Pius Weibel also served in a leadership role as the County Facilities Committee Vice Chair from 2004 to 2006, the Public Aid Appeals Committee Chair from 2006 to 2012, and whereas during his tenure as Champaign County Board member, Pius led the County Board as County Board Chair from 2006 to 2012, providing leadership through his insightful, balanced, and comprehensive attention to all issues requiring deliberation and action by the County Board. And whereas the Champaign County Board seeks to publicly recognize the commitment and dedication of Pius Weibel, who served the citizens of Champaign County as an elected official over a term of 8 years and as chair of the board for 6 years, providing stable and measured leadership in the development and implementation of good governance and management of the County Board's responsibilities and resources. Now, therefore, be it resolved that the Champaign County Board hereby recognizes the service of Pius Weibel and the benefit that service brought to county government, and be it further resolved that a copy of this resolution be presented to Pius Weibel in recognition of his years of public service and leaderships to the citizens of Champaign County, presented, adopted, approved, recorded this 27th day of November 2012, Thomas E. Betts, Vice Chair. Finally did get to put my signature on something. So moved.
Second.
Second? All those in favor?
I'm sure now.
Okay, go for it.
Okay, second by Mr. Carter. All in favor?
Aye.
Opposed? Motion carries. Come on, Jim. Got it? All right, thank you.
Pius, no, you're not so easy. In honor of C. Pius Wabble for his distinguished service as chair of the Champaign County Board, December 2006 to November 2012, we present you this plaque.
Okay, we have a special item on the agenda, final thoughts by the county board members. Mr. Moser.
I'd like to go back to 1996 when Tom came on the board. Parker had been board chairman and he pretty well had everything in a mess. We started a youth detention center on a wing and a prayer. We didn't have any money to pay for it. And the only thing that saved us was a 1/4-cent sales tax that built that building and all the rest of the buildings that we've been associated with since that time. And if there was ever a time this board came together and did what they had to do, it was then, because Judge Schonkweiler had told us, you build a courthouse or we're going to build it for you. And there's no way we could have passed a bond issue for that $27 million building where it ended up. And the Democrats, with Tom and Jerry Parr and myself on the Republican side with Steve O'Connor and a lot of other people got together and we decided we're going to put this on the ballot and we're going to pass it. And we did. At the same time, Barker infuriated the employees to the point they all wanted a union representation. From 1998 to 2000, the two of us and Mr. O'Connor spent a good half of our life in Brookings settling labor contracts and trying to build the framework for the courthouse that Steve Beckett and his committee finished in 2000, and Jan was there. And to me, that was the roughest time of all the years I've been on this board and the most challenging. And it was the greatest get-together of people that really didn't see eye to eye on very many things. Got together and got it done, and we're in a much better position than we were when Tom Betts came on this board. And I publicly want to thank him for all the help he gave me through those 3 years.
Other thoughts? Mr. Betts.
Well, I'd like to repay a compliment. Steve Mosher is right. We don't agree on very much. I'm very, very liberal on most issues, but we did come together to build a courthouse and youth detention facility. We still have the whole issue of justice that's still out there, the never-ending issue. We did manage to deal with the facilities issues. We were able to raise money. We were able to, I remember a night in my house where there were actually more Republicans than Democrats, which has never occurred in my house, where we were putting together flyers, mailing them out, I provided the liquor, which always helps. And we had a great time. We worked till midnight. We got it out. We carried the day on that vote, and it has made a huge difference in this community. I have always been very proud to be on the county board, even when I have disagreed, when I have been 26-1 on issues like my friend Patsy Petrie is quite often. It's an honorable thing to be in dissent. It's perfectly okay. There's a long line of people like Vicki Stewart, the late Vicki Stewart, who served on this board, who held a record for a long time of 26-1, and then there was Jenny, who held the record, and then I held the record, and I still think I might hold it. Patsy's coming close. I think it's okay to be in the minority, and it's okay to dissent as a matter of conscience. I don't think I've made too many enemies on the board. A few. Bud Barker is not an enemy. He's an opponent sometimes, and was. Very difficult person to deal with, but I think Steve would agree that because of Bud's intransigence and the way we worked around him, it had actually benefited the county in many respects to kind of have Bud out there. I have enjoyed working with everyone. I remember the first time I met Pius Weibel during the divestment actions at the University of Illinois. I doubt he remembers this youngish attorney at the time, but he was a man of incredible principle, fighting against the University of Illinois' horrible policies of investing in the racist regime in South Africa. And a number of folks got arrested, a number of them were in my office, and I think I shook Pius's hand at some gathering and saw this long hair. That's a pretty cool person. And he has turned out to be a pretty cool person every step of the way. He and I have had a good working relationship as chair. He's put up with me, and I'm very difficult. And Mosher knows, when he was chair, I was difficult to deal with. I am pushy, obnoxious, demanding, and I think that's good. Chairs don't always think so, but I've enjoyed working with every chair I've worked with. I've enjoyed all the members of the board that I've worked with. People I disagree with, people I agree with. I think this is a great, democratic, small d board. It's the best form of grassroots government you're ever going to have. We are not beholden to outside interests to fund our campaigns or anything else, and that's important. Thank you.
If we hadn't known it before tonight, we know it now. We've come to an end of a rather unique era, period, in the government of this county. We're losing most of the people that were responsible for it. We can only hope that those of us who remain and those of us who are coming in will be able to do half as well. Period.
One more thing. One bright thing we did in 1997 was elevate Deb Busey as county administrator.
Well, I being the shortest term that is currently on the county board that's retiring out, it has been an absolute pleasure. I wasn't going to do this. Serving alongside all of you has been insightful, challenging, but it's also been informative, and you have all served with good conscience, and it is exciting to see that there are so many people that care about the good of Champaign County, and that's what we do. We come together and we put our ideals out there, and we do what's in the best interest, what we believe is to move Champaign County forward. We have great leadership. Deb is fantastic. Thank you so much for letting me come in your office so many times and chat things over. For the support of that healthcare committee, which has, I think, going to be phenomenal for Champaign County to get to be a part of that, and you all giving me the go-ahead to get that started and working, and seeing how the county employees at first resisted, and that they have come together and very much appreciated the fact that they're at the table and they're able to negotiate their health care And I hope that moves forward into a wellness program and that we continue to save county residents. This has been a lot of fun. I'm going to miss you guys, but I'm going to be watching you and coming in to some of your meetings, I hope. But I think that the one thing that I always thought was interesting is after a very laborious, contentious meeting, someone would inevitably walk up to me and say, "How can you stand these meetings, Stephanie?" And I would just smile and say, "Oh, but we're not enemies. We're just here with our ideals, making our community a better place." And we might have a D or an R behind our name, but what's important is that we do move forward and that the new board, the smaller board, remember that that's what's important. It's not about a D, it's not about an R. It's about coming together as different as we are and making a better tomorrow. That's what we're responsible for, and that's what you new elected officials are called to do. And you remaining officials, you're called, you've been elected, you've been voted in to make a better tomorrow. So I challenge you to continue to do that. All of the challenges that you have facing you, and there are many, do it in a manner that you can be proud of and that your grandchildren can be proud of and future generations beyond that, because we all do leave a mark, whatever we do and whatever we say. So thank you so much for supporting me in my efforts in moving things forward, and thank you for being there to lean on, ask questions, and best to all of you in all of your future endeavors, those of you that are going off the board. And Steve Mosher, I'm going to miss most of all with your grimacing and just your humor and your insightfulness and your leadership. So thank you very much for being such a great leader to Champaign County.
I like Stephanie's remarks about her friends wondering why she likes to serve. I've had many friends ask me why I would want to be on the county board, but it's been a pleasure serving 12 years, and I will miss all of you. There will be things I look forward to doing, but I'm afraid I'm going to get in my car and it's going to just head over here on automatic pilot because it's done it for so many times. But I've enjoyed working on the committees. I've enjoyed my liaisons to the mental health board particularly. It's a wonderful staff. It's a wonderful board. It does a lot of wonderful things. Working on the MLK and the nursing home boards. I've enjoyed that too. But just the things that I don't have anything quite as dramatic as Steve Mosher has to share, but there have been a lot of things that we've worked on together. And I don't know, is that still here or not, but I think sometimes they make us look like we are this contentious board, but I think it's just that some of us have different ideas, but I think we work them out well. People are courteous and welcoming to each other. It's a friendly room to walk into, and I will miss that. And I wish the new board that's going to be seated in December all of my best wishes, and that they do well, and that they will look, to that legacy from before, and will find that they can work together just as well as this board is working on. So I will miss all of you. I won't see you as much, but it's been a pleasure, and I've enjoyed my time on this board.
Just like to say thanks to everybody. I'm not sure I'm supposed to be proud of this, but it was always more fun than it was work for me. And that's mostly because of you, my colleagues. I can't think of anything negative to say
possibly the night we worked till 10:30 news time debating the price of candy bars at the jail. Other than that, it's been fun. Thanks to everybody.
Well, a few words. Certainly it's been an honor and a pleasure to serve on this board with all of you and the previous county board members. I feel when I get on the county board, I never thought I'd be chair of the board. I didn't think I'd be chair of the committee. Stuff happens, you know. But let's say it's been a real honor to serve with you and for you as the chair. The chair actually serves for you. It's, you are ultimately the body of the person who controls these meetings, and you do that as person who operates as the chair. I really enjoyed meeting all of you, getting to know all of you. It's a great pleasure. And certainly it's going to be a great memory I'll always have. I hope to see many of you again in the future. I also want to thank my family. Who's still on the audience, and this is their second meeting. You guess what the first meeting was. Oh, well, take it back. Apparently, my oldest daughter was not a. No, my daughter's the first meeting, apparently. So, thank you for coming. You put up a lot with me by not being out at home, and I appreciate your forgiveness for that. And finally, I want to point out that there's a kind of member here I met 35 years ago, before I became Champaign Urbana. It was Ralph Langenheim. I met him in 1977. So in a way, he's responsible for me eventually coming to Champaign Urbana. So I appreciate that. I appreciate my long friendship time with Ralph as a student, teacher, minister, as professionals in the field judge together, and as politicians together. So I appreciate that. And I also appreciate working with the staff, Champaign County, fellow politicians, both appointed and elected. Thank you very much for this opportunity. Anyone else who wishes to say anything?
I would, but forget it.
Mr. James?
No, I give you enough of a hard time, I'll pass.
All right, final word, Mr. James requested to have the final word, so.
I would like for you and Deb to meet me at the podium if you would. I need you yet, Mr. Chair.
All right.
I think it'd be remiss of us if, first of all, with the talent that's leaving the board, it's bittersweet for most of us. As you sit and look around at all of the history that's leaving and the commitment and the service that these folks have given us. Be remiss of us, though, if we didn't mention somebody that's really the glue of the county and has been since, I forgot what the date was, Mr. Mosier said. 97. 98.
Parker elevated.
Deb Busey is without a question the glue that keeps us all together. I don't know how, when you look here, that she walks this fine line. She has to get along with the Democrats. She has to get along with Republicans. She always manages to do that, but I know how. She shared her secret with me. Deb always makes her decisions on trying to do the right thing for the county, not for Stan James or not for Al Kurtz, but she does what she thinks is best for the county. And I think that's the goal she set that we all, as our caucuses, should try and fulfill. Having said that, Deb, now I know you didn't know about this, but and Pius, I appreciate your assistance. In grateful appreciation of many years of distinguished service to Champaign County, your exceptional skills and extraordinary management abilities have enabled this county to move through some very difficult times. Please know that both the Republican and Democrat caucuses of the Champaign County Board, and more importantly, the public we serve, are deeply indebted to you for your I have a little problem with this word, exemplary leadership and counsel over the years. Thank you, Deb, from the bottom of our hearts, from all of us, presented this 27th day of November 2012 with a footnote Again, this is from both the Republicans and the Democrats. We hope, this is the retain you, by the way. We hope that you will serve many more years at Champaign County. You are truly the most eminent administrator that the county has ever had. May God bless you and thank you.